to order for the winter meeting, December meeting of the North Carolina Secretaries Science Advisory Board. Welcome and thank yous go to Franny for working with the department's plural leadership on putting together the agenda for today. Thanks to Paula, who's not seeing the room anymore, but thank you, Paula, for help with other logistics. And Julie Robinson is working IT for us today. So for anyone listening online, especially if you're one of the 5 panelists that we expect to be online and you're having any technical difficulties, please email or chat Julie Robinson. And thanks, Julie, for your help with that. And thanks all of you for attending. Joining us in the room online, I expected, based on talking yesterday, that we would have David Howard, Rich DiGiulio, Gina Kimball, and Jamie DeWitt joining us virtually. And I did hear from Dr. Aneja that he is out of the country and will not be able to join. He's in India on an exchange program. A reminder that the meetings are recorded, so the mics are live. If you're not speaking, maybe push the mic away. If you are speaking, please hold the mic closer to you so that we have a quality recording. Because we have so many people joining online, y'all can help me if it's been a while since I checked in with them about whether they had any comments on the issue. Please help me do that. And I guess I'll ask for Julie's help on that too. If you can monitor the chat, if somebody says that they want to make a point and I'm not seeing it, please let me know. But it's a two-way street. Any of you panelists that have joined remotely, if you have a point to make, I can't really tell that. So feel free to chime in if I haven't paused and asked you explicitly. Because we have so many people joining online, the few times that we'll be taking a vote, I'll probably do that one at a time to make sure that we hear from people. And I guess finally, before we move on to our first action item for the agenda, I'll see if there are any speakers who've signed up so far, because sometimes that modifies the order in which we would do things. The public forum is until the end, but if there were speakers, it might be important to put them more topically than at the very end. All right, well, having no speakers then, I think we can move on to agenda item number 2, which is to vote on accepting the agenda as drafted unless there's any changes. So the draft agenda was circulated by Franny on November 25th. It's been unchanged since then. Are there any questions or comments on the agenda as drafted? No. For me. Hearing none, it would be appropriate to entertain a motion then to adopt the agenda as drafted as a final.
So moved or seconded, whatever.
To have a movement and a second. So all in favor, aye?
Aye.
Aye.
All right. Great. Thanks. That's,
Aye.
thank you, David, Rich, and Elena. I think I recognize the voices so far. Is that right? And how about, have we been joined by Gina or Jamie?
Yes, this is Gina.
And
Agenda
Jamie's
okay
here.
The agenda okay with both of you?
Yes.
Yes.
All right, super. Thank you so much. We appreciate it. And welcome to the meeting, and thanks for participating remotely. That brings us to agenda item number 3, ethics statements and the opportunity to speak to any potential conflicts or the appearances of such. So Franny has it on the screen, and I'm going to need to call it up on something a little bit closer to my eyes to be able to read it. In accordance with the State Government Ethics Act, it's the duty of every board member to avoid both conflicts of interest and the appearances of conflict. If any board member has any known conflict of interest or is aware of facts that might create the appearance of such conflict with respect to any matters coming before the board today, please identify the conflict or the facts that might create the appearance of a conflict to ensure that any inappropriate participation in that matter may be avoided. If at any time any new matter raises a conflict during the meeting, please be sure to identify it at that time. So I'll open the floor for feedback from any of the board members with regard to the conflict of interest reminder and the agenda that we just passed.
Tom, this is John Vandenberg.
Yes, John?
One of the topics for today is 1,4-dioxane, and I was the division director responsible for the IRIS file on 1,4-dioxane back in 2010 and 2013. And secondly, in 2024, I served as an expert witness for the state of North Carolina on a case related to 1,4-dioxane.
Thank you. That's.
Thomas,
just
this
gonna
is
say
Jamie.
that-
Can you hear me?
We can. Go ahead, Jamie.
I just wanted to confirm that I serve as a plaintiff's expert witness in cases involving PFAS, including in cases in North Carolina.
Thank you. Anyone else?
This is Detlef. I received state and federal funding to conduct research related to PFAS and also in the past on 1,4-dioxane.
Well, the agenda is replete with PFAS items. No action items related to PFAS. The only action item is related to 1,4-dioxane. And for any of you that were involved in producing that report or foundational documents associated with that report or its review, which I think is almost all of us were involved, at least in the review of the document. Thanks for your comments on potential conflicts, and I'll trust you to limit your involvement in the discussion to whatever you feel is appropriate in terms of referring to the facts or your opinion on the facts. And we may or may not get to a vote on the language associated with that today, depending on the progress we make on that agenda item. All of the PFAS items on the agenda are informational only. So I think that brings us to agenda item 4, which is the minutes from our October meeting. They were circulated in draft by Franny on October 30th. And they remain unchanged. Are there any questions or comments on the minutes of the October meeting before we move any further?
I would just say this, John Vandenberg, that I again appreciate the links to the actual recording. That's very helpful to me to go back and hear what had been discussed. And otherwise, I would move to accept them.
All right. Any other questions or comments on the draft agenda? I'm sorry, the draft minutes. We have a motion on the floor to accept it. Is there a second?
Second.
We have a motion and a second. For those in the room, and then I'll call on those on the phone individually. All in favor?
Aye.
Aye, all 4 in the room. So how about David?
Aye.
Rich?
Aye.
Gina?
Aye.
Jamie?
Aye.
And Elena?
Aye.
Well, thanks so much. The minutes can be moved from draft to final and posted on the website accordingly. So we'll let DEQ handle that.
Turn the volume down on the people who are not here a little bit.
The
Loud.
We'll try.
It's very loud up here. I
It
don't
is
know.
loud.
Well, thanks, everybody. We're moving right along. That moves us to agenda item 5, which is updates from the agencies that appointed us and for whom we serve along with the public. Guess I'll call first on Sushma Masemore, the Deputy Secretary of Environment for DEQ. Good morning.
Hope you all are doing well. Thank you for this meeting again, our last for the year. What I wanted to just highlight are 2 items, as you are going to get significant amount of background material and updates from our divisions on various programs related to emerging contaminants. The 2 key things I wanted to bring up to your attention is more of recent work that our department is doing, which is related to a variety of sampling and testing occurring in the various parts of the state in addition to the Camorra's testing that we've talked about frequently. The most recent one that perhaps might be of use for information is an area in the Piedmont Triad region called the Pleasant Garden Township. That is where our Division of Water Resources, through the various grants and internal funding that we had, have been testing for small disadvantaged communities and community public water systems. These are those that are serving more than 25 individuals, and that we've been providing testing services to schools, daycares, nursing homes, and so on. And out of that testing program over the last year or so, we have identified a few areas that were clearly above the EPA's maximum contaminant level, which is the regulated concentration at which drinking water is going to be regulated under the Safe Drinking Water Act. Through that program, our division staff, Division Water Resources, Public Water Supply team has been in contact with the school systems and other small systems they've tested. And Pleasant Garden was one of those areas where the numbers were above the MCLs. We're looking at between 2-3 digit values for PFOA, PFOS. While those conversations and discussions were ongoing with the school system, there was another work occurring with the North Carolina Collaboratory, and Dr. Knappe has been part of that work. And they're looking at the PFAS in groundwater at fire stations, particularly those fire stations that do training exercises. And then they have a joint program with the Collaboratory and the researchers, and also our Division of Waste Management. And through that program and the testing that they did at the fire stations, they've identified the fire station at the Pleasant Garden as having high levels of PFAS, particularly PFOA and PFOS. There are other chemicals that they were found there linked to the firefighting foam AFFF. And related to all of this finding, the Collaboratory initiated communications with several members of our North Carolina General Assembly and DEQ and so on. So about 2 weeks ago, we were invited to attend along with Zach and Virginia and the Collaboratory team to present our findings and discuss potential next steps to the community. It was a town hall meeting, very well received, but very informative. Obviously, many residents are concerned. They had lots of questions. But we were able to whittle through lots of those higher level questions. Where we are right now on that is our Division of Waste Management is offering our Bernard Allen program to all of the homeowners that are on private wells to have that water tested. We're also working with the school system, the nursing homes, and the daycare. The fire station is being worked with by the Collaboratory to get them off of the water supply. So ongoing work. We've had a tremendous positive response from the homeowners. Vince and Michael and his team are actually leading this work. So far, it looks like we have over 100, maybe 150 people signed up in less than a week, which is a pretty good response. Our team has been working since Thanksgiving, been out there on a daily basis collecting samples. We should have some data within mid-December, third week of December, to know potentially how far the contamination may have gone. Our goal is to canvass every property within 2,000 feet of the fire station initially. So just wanted to let you know that that's been out in public domain, and we're working through that with our partners. The second item I wanted to highlight was an update that we gave to the Environmental Management Commission on our biosolids study. Our Division of Water Resources and several of our divisions and leadership staff worked to complete this study. We funded this study through DEQ, through whatever available funding that we had, to get an initial investigatory understanding of the biosolids landscape across the state. That study consisted of sampling a total of about 3 domestic wastewater treatment plants that receive no industrial waste. 8 industrial wastewater treatment plants and 26 municipal wastewater treatment plants. And so what we did out of this study was we collected raw water samples, the effluent discharge samples, and also the concentration of PFAS in biosolids. And then we also sampled about a total of 19 land application field sites. Nothing compared to how many land application sites are there. It was an initial grab samples of a few sites that we knew where the origin was and where they were ending up. And so that study data summary was presented to the EMC at their November meeting. It was very well received. We're still working through it. That data will be available on our website this month. We're happy to provide some of the key takeaways to the board in the future. But the one thing that I did want to give you just as a highlight, since you're going to be hearing so much on PFOA and PFOS, which are the two primary chemicals that the current EPA administration plans to confirm its MCLs for. In the biosolid study, we did detect PFOS in all of the biosolid samples that we tested, all the sites that I just mentioned. And the report identifies the level of concentration ranges that we saw across the different places. We did see that 2 to 13% of the biosolids mass entering a wastewater treatment plant ended up in the biosolids on a mass basis, which means that over 87 to 98% of the PFAS entering a treatment plant was exited through the effluent stream, meaning that that's what was discharged to the surface waters. So it gives you a relative contribution of where, from a policy perspective, from a regulatory perspective, but also from minimization, where the state and the industries can focus on reductions of PFAS from the source itself. And when we say source, we're really talking about those original sources where PFAS originated. Often the word source is misunderstood, that we're talking about the treatment plants. Really, they're the recipients of domestic and industrial waste. So we'll be going through all of this data with the host sites to figure out what we can do further to reduce the discharges. So I wanted to stop there and pause for any questions. You'll hear a lot from our Division of Air Quality and Division of Waste Management on our ongoing work in this area.
Thank you. Are there questions from any of the board members in the room first? And then I'll go to online. Detlef?
Yeah, thank you for the update, Sushma. On the biosolid study, did you also apply the total oxidizable precursor assay in the analysis?
We did not.
Okay.
We were limited. We sent the samples over for 1633 in the modified test method for Chemours compound.
Mhm.
So our initial goal was just to canvass that. Again, it was a first shot at it. And so that's what the data currently encompasses.
Yeah. And just bringing it up because of, in the Burlington case, some very high levels of PFAS were tied up in particulate PFAS that can break down over time, and you can see that with a top assay, but it wouldn't show up with a regular extraction of the biosolids.
We agree with that. And one of the things that we'd like to explore next is, as the collaboratory is working on their next phase of the PFAS network testing, we want to contribute towards that design, and perhaps we could expand that understanding.
Sounds good.
Question.
Also,
Thank you very much for the update. Going back to the fire station, it seems as though you're implying that the fire station training area was the source of the contamination in the community of the Pleasant Gardens. Am I following that correctly?
Yeah, the fire station has a groundwater well, and based on the sampling and the analysis, the PFAS levels, and perhaps you could even say the fingerprint is associated with AFFF use. There is a training facility and there is a building structure where such activities occurred.
So would you anticipate that would be the case for other fire station training areas around the state?
Possibly. Again, the source identification is the hardest part
Right.
of what we do. Sometimes you have multiple sources. And in fact, we're not even sure it's the only source. The main thing is to get folks on clean water as soon as possible, get these services out, and then as we try to figure out how far the extent of contamination is and then what the root cause could be, and then address it that way.
Thank you. Yes.
Detlef, one more, and then we'll move to
Maybe-
folks on the phone.
Just to follow up on this, as part of a collaboratory funded study, we collected well water from 417 rural fire stations across the state. And these are all fire stations that are not served by public water. And I would say, based on the samples that we've analyzed so far, Pleasant Garden is more an exception rather than the rule, but there are probably a few others that will need attention.
Okay. Thank you. That's very helpful.
Pause and see if any of our panelists joining us online have questions for Deputy Secretary Mace-Moore, the material she's covered so far.
This is Elaine. I have a question.
All right, go ahead, please.
When do you anticipate that a physical copy of this study will be available?
The biosolid study?
Yes.
Yes, we're rolling it out in 2 phases. The first is a website release. This is often how we've done the landfill data that you'll hear about later. So we're going to be releasing the data file that contains all of the measurements results for the sites that we tested. It'll be a more of a spreadsheet kind of a table. There will also be the EMC presentation we've used because it includes a lot of the key talking points and summarization. So there will be a website release that has some background material, the EMC presentation, and we're currently looking into adding the Comores summary, which we were not able to complete for the EMC presentation. So we're still finalizing what the biosolid study revealed for those sites for the Comores signature compounds, which are under the consent order.
Thank you, Sushma.
And our goal is to get that out before the end of the year. And the second phase of the release is more of a report that is a presentation of the data, but also analysis and further conclusions and evaluation of what our key findings are. And that's going to take a little bit of time. We want to work with the local municipalities and the wastewater treatment plants. They've been doing these tests for many, many months and years, and want to make sure we're able to integrate some of their understandings and findings, and that it is not just based on just DEQ's work, but it does include some third-party lessons learned across in this media.
Any other questions for the material covered so far from the panelists online? Then I'll give it back to you, Deputy Secretary.
Thank you. Look forward to the rest of the day.
All right, thanks. For DHHS, we'll be joined by Dr. Virginia Guidry, who's the branch head of occupational and environmental epidemiology. Good morning.
Good morning. Okay, nice to be here with you all today. Let me get started on our DHHS updates. So first of all, DHHS would be remiss if we did not mention that respiratory virus season is here. I hope you all are getting your flu and COVID shots. We are continuing to conduct wastewater surveillance for COVID-19, flu, and RSV. Our COVID levels are currently low. However, flu is going up. For flu A, we have not detected any flu B, and we are starting to detect RSV as well in the wastewater. We are also currently testing for measles in wastewater across the state, but there have been no detections of measles since the trace detection over the summer that was associated with a travel-related case. We use wastewater surveillance to complement our other surveillance systems, and those surveillance systems are also showing similar increases with ED visits emergency department visits starting to increase, currently driven by flu, and hospital admissions also creeping back up, although they came back down after the initial COVID wave we saw in September. When I presented in October, I mentioned that results were forthcoming from our Community Assessment for Public Health Emergency Response, or CASPER, that we conducted in Buncombe County after Hurricane Helene. Those results are now available online. So in that case, we went to 210 households and surveyed them on a range of health issues following Hurricane Helene. The most common health need reported was for behavioral health support following the storm. We surveyed on a range of topics, and I just thought I'd focus a little bit more on the environmental health topics as well, which focused on household water quality, private well testing, and mold and indoor air quality. For household water quality, at the time of our survey, which was in June, 21% did not feel that their source of tap water was safe. And that is after all of the efforts that have been done in that area to fully restore municipal water supplies. And so it just showed some continued reservation about those supplies. We also found that of the households surveyed, 76 that used a private well, only one reported that their well had been flooded after the hurricane and it was tested and treated. But there was a lot of interest in private well testing and the availability of testing kits at the time. And then for mold, of our respondents, 14.3% saw mold or smelled musty odors in their home after the hurricane. And in June, at that time, still about 60% had mold or odors in their home, from what they had observed right after the hurricane. And we found that barriers to mold remediation included cost and unresponsive landlords for renters, which is a challenging problem. Our recommendations included expanding access to coordinated whole person healthcare with a focus on behavioral health, partnering with community organizations to strengthen awareness of emergency preparedness, knowledge and resources, and developing and implementing a comprehensive environmental health education initiative, including linking the community to resources. And that was all done in collaboration with Buncombe County Division of Public Health. And so they continue to follow up on those items as appropriate. For PFAS, as Deputy Secretary Mazemore mentioned, we attended a public meeting in Pleasant Garden about PFAS detections recently and answered health-related questions as needed. We are continuing to discuss potential fish advisories internally. As you know, the fish data were presented at our last meeting. And we're currently reviewing the guidelines that came out in September 2025 from the Great Lakes Consortium for Fish Consumption Advisories. Those are specific to PFAS, and that's some new information for us that we're reviewing and considering as we discuss potential fish advisories. We are also continuing to review the emerging literature on dermal exposures to PFAS. And then this week, we're actually currently attending the 2025 Great Lakes PFAS Summit, which is virtual as we are able. We continue to support areas of the state that are facing environmental justice concerns. We recently worked with partners to successfully increase the inclusion of environmental justice and environmental health disparities in the 2025 community health assessments that were conducted by local health departments. We actually had 13 local health departments that included environmental justice chapters in their 2025 community health assessments, and 30 included a map of the CDC Environmental Justice Index with an additional 4 mentioning environmental justice in their community health assessments. We also participated in a meeting of the Heat Stress Coalition just this past November to discuss approaches to reducing occupational-related heat-related illness, which also has environmental justice implications, given the occupations that are often impacted by heat. And then lastly, about heat, our final report from the 2025 heat season will be available very soon. And I mentioned this at last meeting, but just a quick reminder that we documented over 5,600 emergency department visits for heat-related illness this past summer. And that was 1,400 more emergency department visits this year compared to the same time period in 2024. And that's an average weekly rate of 2.6 per 100,000 people in the state. With that, I'll stop and take any questions that you have.
Thank you, Dr. Guidry. Are there any questions from people in the room and panelists in the room? And then I'll move on to panelists online. John?
Thank you very much for the update. That's very impressive, the work that you've done. I appreciate especially the work in Buncombe County, because I've been out there with some friends and people are very stressed still, more than a year later. I wonder if you could speak to the, I guess it's an email we received from a person, Megan Tichy, about fluoride. Just give us an update on where things stand with fluoride. And I know, Tom, you also spoke to that individual, so maybe the two of you could kind of share where things stand with that in your response. Thank you.
Yeah, I'll start. I mean, we did work with Tom and help to support the response back to the concerned individual. Tom sent the email response basically saying that we are continuing to evaluate the literature on fluoride, and then also followed up with the individual by phone. That is ongoing for us. We don't currently have a specific request to respond to, but we are continuing to monitor the literature there. And Tom, I don't know if you have anything you want to add to that.
No, the board approved the response before I sent it because it was an email to all of us. And then I just followed up with a phone call, left a message, and did not hear back with an offer to dive into it more and to express appreciation for people weighing in, because it's a bunch of board panelists that are volunteers and want to serve the public as well. So that's the last I heard of it, was the message that I left.
Thank you.
Are questions for Dr. Guidry from any of the panelists online? All right, thank you.
Thank you.
Appreciate it. That moves us to the one and only action item on the agenda today. After that, there'll be some informational items. So we are, I've asked Franny to pull up some slides that I drafted to remind people where we've been and try to frame the issue. And then we'll have time for discussion. We probably have until about, we have close to an hour till about 11:30 before we need to make time for the other presentations. This is my history, just intended to frame it. So if you can click, I don't have, be able to control it here. We received, and then we talked about and modified the charge from DEQ in December of 24. They came to us and said, we want you all to do a review of this 2024 document. It was turned in May of 2024. And that's when we got the charge finalized. In March of the following year, a link to the actual finalized risk assessment was sent to Science Advisory Board members with a request to refresh your memory on it and give it, kick the tires on it, because it was going to be the subject of the April meeting. So you can go to the next one. And then at the April meeting, we discussed the document, and I put step-by-step in there. That was kind of two different step-by-steps. We went through the documents, exposure and effects assessment, and step-by-step. And then we also asked a series of questions about what scientific reasonableness, would indicate in terms of decisions made, how they were documented, and whether or not the report would be reproducible, things like that. So next slide, please. And then in September, the draft synopsis was circulated to the Science Advisory Board. The synopsis was drafted largely from the recording of the April meeting, pulling out salient points and distributing it to the Science Advisory Board for review and comment as a draft. The next one. And at the October meeting, there was further discussion of that draft and revision. So we received comments on the draft from September. And then there was further revision in October. Because we revised it in October and there were some members not present, we didn't vote on it then, even though there was a consensus of people in the room that the language was acceptable. There were some panelists who weren't at the meeting, so we didn't vote. We instead sent the revised synopsis back around to everybody in the middle of October. And then on early November, one Science Advisory Board member requested that we revisit the issue and suggested some additional edits that we could talk about today at this meeting. So next slide, please. So just to refresh your memories a little bit more, this is the request posed to the Science Advisory Board from DEQ. This is as modified at that December meeting to narrow the scope or to focus the scope appropriately. And that was a back and forth between the folks that were requesting the review and the panelists in terms of, what issues do you specifically want to talk about for a report that was finalized back in May. So the bottom line there was scientific reasonableness. You can go on to the next one. You're doing good. Since April, this is my perspective now, and we'll have time to talk about it. Since April, it's my observation that there has been agreement that the approach and findings of the risk assessment are scientifically reasonable. I say that because the next bullet there, we've had two, and the third iteration of our response to charge has concluding statements to that effect. For example, all three iterations of that document have said, overall, the board recommends that DEQ's human health risk assessment for 1,4-dioxane in drinking water be among the resources used to inform and support decision-making next steps, as the methods, data, analysis, conclusions are scientifically reasonable and defensible. So that hasn't changed through three different versions of how we respond to the charge. What is the focus now, I offer, is the language around the cancer slope factor, agreement on how reasonable it was and how we characterize that in the response to charge. So broad general agreement with the charge, some disagreement over the course of the last couple of months on the language that's used to document the board's work. So let's go to the next slide. Because that cancer slope factor came from a 2013 IRIS review, I drew the board's attention to where the data were so that we could talk about the science behind it. You could have a discussion of reasonableness based on policy or reasonableness based on the time constraints that were given for the state's human health risk assessment, but the charge was to review the scientific reasonableness. So no comments on the exposure assessment except for support, broad support for the way the effects assessment were done, but for this one issue of what is the board going to say about the cancer slope factor. So the source of that cancer slope factor is the 2013 IRIS document. And I just pulled some quotes out of that document. I'd sent it to the board a couple of times previously, but just to tee it up for people in the room today and to try to focus the hour that we have on what I think the only remaining issue is, which is the words that we use to describe the cancer slope factor. EPA says, that they had 3 chronic drinking water studies to choose from that had incidence of liver tumors in rats and mice. So they had dose response data from 3 studies. They chose this 2009 Cano et al. Study. That's the third time that study was written up. The first time it was published, the previous references were from an agency report and conference proceedings. They chose that drinking water study in part, they said, because that it had 3 dose groups and controls and that they had lower exposure levels than the other 2 studies. So you can go on to the next one. They said that their table 5.7, which I'm going to show you next, has the incidence of the data from rats and mice. So they had 2 species, 2 sexes, 2-year drinking water study. So the drinking water out of exposure was used. And that they had statistically significant increasing trends in tumor response in males and females of both species. They chose the dose response curve for female mice. They acknowledged that it was steep with 70% increase in liver tumors at the lowest dose, and that they had a positive dose response after that in the next 2 highest doses. So the next one. I provide this just to say, that the way that the again, my take on this is that with 3 iterations of the document or the response to charge, the only language that has changed is related to the cancer slope factor. And the cancer slope factor comes entirely from the last 4 lines of that table. It's only the female mice. It's only in Cano et al. 2009. And it's a control and 3 doses. The first dose of which resulted in about a 70% incidence of tumors. The tumors were adenomas and carcinomas under the rationale that the adenomas may be progressing to carcinomas in the future. It's the same cell type. And then an incidence of 82% and an incidence of 92% of the tumors. So that's the data that drives it. That may feel like it's getting into the weeds, but I don't see how that we're going to resolve differences over how you characterize a cancer slope factor without starting from what's the source of the data and how certain or uncertain it was. So that's what they had. The rest of the table is, I guess, interesting background, but we're only talking about how you would draw a line to a health protective value from those 4 data points. I say that also because all 3 iterations of the document that we've gone through so far say that we don't disagree with the state's use of that cancer slope factor. It's just the way we characterize it. So go on to the next one, please. So that's what they had. The IRIS document used, I guess, kind of threw the book at it. They used all of the models that they had in their benchmark dose software. And to that, again, female mice data set. And they said for all models, the benchmark rate of 10% extra risk was employed. And they showed all the models in Appendix D. The next part is where it starts to get more specific to the issue at hand. So the multi-stage model did not provide an adequate fit as determined by the statistics they used to judge the adequacy of the models. For the incidence of, again, adenoma plus carcinoma in female mice. And then here's where their struggle begins because in their words, because the female mice were clearly the most sensitive group tested, they decided to try other modeling approaches to see if they could achieve an adequate fit. So their rationale for focusing in on those last 4 lines of all the available data was because the female mice were the most sensitive. So they tried other models outside of their benchmark dose software and said that the log logistic model provided an adequate fit to the data, statistical fit. Noted again that the slope was steep with a 70% incidence at the lowest dose, and then the next 2 doses of the 3 doses provided 82 and 92% cancer incidence respectively. So again, they acknowledged the steep slope of the data they had. And just a couple more for reference about what the source of the cancer slope factor is. Next slide. So they tried some other things. The benchmark dose for a 10% incidence and the lower 95% confidence limit for the female mouse data were presented in a table. And then they also modeled it for response rates of 30% and 50% to try to get a fit. This is their concluding statement on the uncertainty around the cancer slope factor modeling that they did. The log logistic model was selected because it was the only model that provided an adequate fit to the female mouse liver tumor data. And again, that's those 4 data points, the 0, the 3 doses, and then the 70, 82, and 92% response. It was the only model to provide an adequate fit to the female mouse liver tumor data. A BMR of 50% was used because it was proximate to the response at the lowest dose tested. And the BMDL 50 HED was estimated by applying appropriate parameter constraints to the selected model consistent with their technical guidance. So next slide. So I provide that history again just to say that it's a risk assessment that included a whole exposure assessment, a whole effects assessment. There's a lot that goes into effects assessment besides the cancer slope factor. There's been a lot of agreement on the language in the response to charge. By my way of thinking about it, the only real disagreement now is around the words that we use to describe the uncertainty in the cancer slope factor. So this is the suggestion in the chain, the suggested change provided by Dr. Starr that I emailed all the board members about a few weeks ago. And if we had a motion to revisit the proposed final version of our response to charge to consider this, we can spend time discussing it. The stuff in red would be the proposed changes to what the board agreed upon at the October meeting, but not everybody was present at the October meeting, so we sent it around again for review. And then just two final slides before I'll open the floor to a path forward. This is me again when weighing uncertainty for people to consider. I think the board, the panelists, the board members need to consider, those additional words about whether the uncertainty here is something that we just draw attention to as written, or whether we qualify it as an exceptional amount of uncertainty. I'm thinking about it from the context of how human health risk assessments are done in general, where oftentimes in human health risk assessments, you might end with dividing by 10, 100, 1,000, 3,000, sometimes 10,000 for levels of uncertainty. Oftentimes, there's some highly uncertain data sets in human health risk assessment. In cancer risk assessment, you typically don't have those divisors because of you're going to use a statistical approach. But what do you know with certainty? Some things that came to my mind was that there were multiple studies available that provided tumor incidence rates for mammals. The next point, you can just click through these. The study that EPA is using was a 2-year study, so it's chronic as opposed to acute. Doesn't require as much leap of faith there. The route of exposure was drinking water, which is the same route of exposure that the state was requested to derive a number for by the legislature. That study showed tumor in both species, in both sexes, and EPA chose the mouse data as clearly, the female mouse data as their words, clearly the most sensitive group tested. So they acknowledged that the slope was steep. They tried all their models. They came up with a model that fit the data set well. They characterized that in Appendix D, and that became the same cancer slope factor that the state used in their assessment. So my bottom line to the board members is if you're thinking about adding the language of, how uncertain this cancer slope factor is it uncertain or is it exceptionally uncertain? You have to think about whether or not, how exceptional is it compared to other human health risk assessments. The words matter, and that's really, I think, where we are. We're just down to what words or modifiers we would add, if anything, to the version that was agreed upon in October. And my last point, and then I'll stop talking, is that another aspect of reasonableness is that IRIS risk assessment is still EPA's most recent IRIS risk assessment, and it's available on the IRIS website. I view that as kind of like policy reasonableness as opposed to scientific reasonableness. That's why in the email to the board following Dr. Starr's review, I was trying to draw people's attention to look at the data. Dr. Starr's talking about the data. He's not talking about the fact that EPA published a report in 2013 and the state felt comfortable using it. He's saying, look at those numbers and think about how you're drawing a line through there in terms of level of uncertainty. And I think that's the only way we're going to try to get out of, or maybe find a way out of, whether or not you would qualify what was written in October to add qualifiers to the level of uncertainty around the cancer slope factor, is to look at those data and move forward. So more of a scientific review than a policy review. So if you can back it up 2 slides. that one. In October, we had consensus of those in the room for anything that was not in red, and Dr. Starr is suggesting with the language in red that we revisit this before we finalize it and send our comments back to DEQ. Other sections of the document had edits as well, but this is the one that seems to be the biggest sticking point. So it would be appropriate for a motion to, if folks want to talk about it more versus just focus on the version from last October. We've got a lot of technical back and forth on this issue so far from Dr. Starr to entertain a motion to consider this as alternate language to the board's document, and then we can talk more about it. You can make the motion if you'd like.
Well, let me just amend, as I had hoped I would, add 2 more words to that red line section that says, and the exceptionally large degree of uncertainty surrounding the cancer slope factor. I'd like to insert some of just before the exceptionally large degree of uncertainty, because this alludes to the IRIS documentation of study selection, model fitting, and uncertainty.
So you're saying, and some of the exceptionally large degree of uncertainty?
Yes, I would add those 2 words to make it clear that what my point was that while EPA has done an enormous amount of work over the years on 1,4-dioxane, the story has evolved over those years. The most recent final value from EPA of what the cancer slope factor might be is different from the one in the 2013 document, but not by much. Instead of 0.1, it's 0.12 milligrams per kilogram per day, based on a different modeling approach entirely from the ones that were explored in 2013.
Hang on just a second, because we're still, if there's a motion to adopt the language, then we can discuss it, because this was.
I don't move to accept this except with the addition of the sum of.
So that's on the floor. I mean, you can make that motion, but to talk about it further, let's agree. Let's get people's agreement that they're ready to talk more about it.
I move to add the 2 words "sum of" in front of the red line section that says the exceptionally large degree of uncertainty.
And is there a second? Second. I'll second. So we have a movement, we have a motion and a second to consider the changes that are on the screen with the modification of before exceptionally, it'll say "some of," so it would read, and some of the exceptionally large degree of uncertainty surrounding the cancer slope factor. Can the panelists see this on the screen?
I could barely make it out, but it's there.
One of the panelists will have to let me know whether you can see it.
I can see it just fine.
All right, and so then think about the insertion of the word "some of" before the exceptionally. And then we'll vote. We have a motion on the floor to discuss this as alternate language to that agreed upon in October. And it's been seconded. All in favor in the room say aye, and then I'll run through the panelists. And the idea there would be, if it's passed, then we'll discuss it and we can vote on whether to adopt it. And if we decide that we like this language better, or if it's more appropriate, then there could be a vote later to say yes for that. If not, we would default back to the version that we had agreed upon in October. So this vote, though, isn't to adopt this language. This vote is to discuss it. And I'm doing it that way because we agreed upon language in October. So to revisit it, I want folks to say they're up for, about 45 minutes of hashing this out. There would be another vote on whether or not to actually adjust the language. So all in favor of a discussion to consider this as alternate language in the room, aye?
Aye.
Aye. And on the phone?
I'm going to say nay.
Okay, I'm going to do that next. Okay. On the phone, back to my list. David?
Aye.
Rich?
Aye.
Gina,
Aye.
Jamie,
Nay. Nay.
I heard you. Elena,
Nay.
and that leaves John.
Nay.
Okay, so we have 5 yays and 3 nays. So the yays have it, and we'll have a discussion. Again, we have a couple of other we have presentations before lunch from people that are in the room ready to give those. So let's give this, at least 15 minutes before we revisit a vote on whether or not we would actually change the language. Right now, we've just voted to discuss it. So let's discuss it, and I'll throw it back to Tom, who proposed the change to go on. I apologize for the interruption, but I didn't want to have a big discussion about it if people didn't want to entertain the idea, given that they had concluded it back in October.
Understood.
I got you.
Understood. Well, I am not going to go through all of the details in the comments that I sent to the board after the last meeting. You all have seen them. You have all reviewed them, presumably. There were 2 people who responded to the comments I sent around. One asked an interesting question about the distinction between the 2 cancer slope factors that exist in EPA's literature, 0.1 and 0.12. And I answered those questions. If you want details on that, I'm happy to provide them. The other seemed to misunderstand the intent of my comments altogether and said basically that there was no need for this because uncertainty has already been addressed. And the point I was making with my comments is that while uncertainty has been addressed, it hasn't been addressed in a way that lets anybody understand that there is, at least in my view, an exceptionally large degree of uncertainty for this chemical. So why do I say that? In spite of all of the things that seem to be marshaled in this direction. I say that because all of the drinking water studies don't provide a great deal of information at all about what the dose response is well below the ED50, that is the dose that would cause a 50% incidence of tumors. There are no studies that show tumor incidence below ED50. All of the other drinking water studies that Tom Augsburger cited there have higher doses and higher incidences. So this is the bottom end of the dose response curve where you've got 70% of the animals in the low dose group responding with tumors. This is a question of having a set of data that threatens whether or not a maximum tolerated dose was actually achieved in the study, or whether or not one exceeded the maximum tolerated dose in this study. It's very hard to justify extrapolation from above the ED50 when you're talking about 1 in a million cancer risk at a dose that may be hundreds of thousands of times lower than that ED50 dose. And no amount of modeling is going to solve that problem. The only solution to that problem is to have more data below the ED50, well below the ED50. And without that, you can't do much with the modeling. The modeling, for the most part, is empirical and statistical in nature. The only model of the group that were used to try to fit the data, the multi-stage model, has some biological justification in terms of how cancer occurs. The others are purely statistical in nature. They don't pretend to offer a theory of the dose response curve in relationship to the kind of toxicity that's occurring and at what doses it's occurring. They're purely empirical. And what's interesting is that none of the models fit the data very well. Even the log logistic model had a p-value for goodness of fit of 0.14. It wasn't below 0.1, which is the criterion that EPA uses to reject a model as not fitting. But a p-value of 0.14 means that there's only one chance in 7 you'd get a a sample as extremely different from what the underlying model is projecting as the one that was observed. So 6 times out of 7, you'd get fits that were better than this one. And that bright line of 0.1 probability is just an arbitrary criterion that the agency uses to decide when a fit is too extreme to be acceptable. So I see that the modeling doesn't really provide much information that's useful in trying to make statements about 1 in a million cancer risks. And to illustrate that, I just want to walk you through a very simple kind of poor man's risk assessment for this compound. Suppose we just looked at the low dose in the study, 70% incidence at 66 milligrams per kilogram per day, 7 out of 10 animals. That's 21 out of 50, I guess. No, 35 out of 50. I'm not very good thinking out numbers on my feet, but if you say, all right, let's just take that one data point and ask, well, what's the upper bound on the incidence that it could be if the true risk were 70%? And the answer is an upper bound of, where is it? Forty tumor-bearing animals instead of 35. That's the upper 95% confidence bound on the incidence if the true incidence were 70%. And you draw the straight line from 40 tumor-bearing animals out of 50 down to 0. What slope factor do you get? That is a slope factor, and it's 0.0806. It's just a little bit lower than 0.1. If you take the top dose, which is 92% of the animals have tumors, and ask, well, what is the upper 95% confidence interval on the incidence at that dose? You get, where is that number? 49 instead of the 46 that's projected or was observed in the study. Draw that straight line down to 0. You get a cancer slope factor of 0.0766 after you adjust for the human equivalent doses to the ones that were used in the study. So there's very little information that's coming out of the modeling that's different in a qualitative sense than just using a straight line down from the actual tumor-bearing animal incidence in those groups. And to me, that speaks to the weakness of modeling on very poor data. And I would call having all of the dose groups showing incidences above 50%, very poor data. The study design was not effective in determining what the shape of the curve is going to be down near 1 in a million or even 1 in 100. And that's my principal concern with this all along. EPA has recognized this by trying to tweak the modeling, by throwing away the high dose, that didn't make much difference, by using different models, that didn't make much difference. And the irony is that really none of the models fit the data very well. And I would hate to hang my hat on data like that without at least acknowledging that there is an exceptional degree of uncertainty with these data that has not been acknowledged explicitly so far. So that's my point. What I'm asking for is not to redo things, not to reject the slope factor, but to just acknowledge that there is some exceptionally a large degree of uncertainty in this case. And I'll stop there. Happy to engage in discussion.
Thank you, Tom. That's where we are. Any panelists in the room or online have other perspectives to add or questions for Tom about the observations that he has shared both in writing and again today? Again, there's it's the language that's used to characterize the uncertainty around the cancer slope factor that seems to be the last issue with this response to charge, which has again already concurred that the state's approach and methods were scientifically reasonable.
this is Jamie. May I ask a
Jamie,
question?
we're having a little bit of trouble hearing you, so can you speak up, or maybe that's something that somebody here has
Sorry,
to do?
I'm in my vehicle. Can you hear me?
Yeah, we can now.
Okay, so I just had a question for Tom. At the October meeting, he asked if there had been other IRIS risk assessments with what he classifies as extreme uncertainty. And I'm wondering, Tom, did you happen to look through IRIS and peruse to see if there were any other assessments that had the same degree of uncertainty that you perceive in this particular assessment?
I haven't made a careful study of what IRIS assessments are out there. I have only my own personal experience with assessments for chemicals that I've worked on as a consultant. And there is one that formaldehyde, in which the most recent modeling approach using a time to tumor analysis with a multi-stage Weibull model was conducted. And I pointed that out in my comments that was done. But there were issues in this study that were not problematic in the formaldehyde analysis because, for one thing, cause of death assignment was carefully done and documented. Pathology working groups contributed to that assessment in terms of assigning cause of death. Cause of death is important in time to tumor analysis in a way that requires the pathologist to make a tough call, looking at every animal and deciding whether or not it died from the tumor or from some other cause. And this study has no documentation of that in any detail. In fact, the data are only available to the public because IRIS chose to, or EPA chose to publish those data in this 2013 or 2020 report, 2024 report. So the answer is I haven't done a careful study. My experience is that this is very unusual. It's unusual to find a dose response that plateaus at very high doses like that and attempt to do modeling from there on down. I have not done that.
I have a question, but I'm going to wait and see if other panelists have other questions for Tom or other observations on the cancer slope factor and what, if any, qualifiers you would put on it other than the one that was agreed to in October.
I have a comment.
So John's going to have a comment, and then I'll pause again for panelists. Just want to make sure that they know that they're ready to, it's time for them to chime in.
Okay, very good. First off, Tom, I'd like to thank you for sending around the various IRIS documents, and you marked it up very nicely, kind of directing our eyes, because there's over 1,000 pages of things to look at here. And one of them that I think was not available at the time that the state's report was developed was from November of 2024 that you just referred to, which was the supplement to the risk evaluation for 1,4-dioxane that was published by the Office of Chemical Safety and Pollution Prevention. And I noted earlier that I was involved in the earlier work on the IRIS development as well as serving as an expert witness for the state. So that document was not available during any of that work that I was involved with. I would just like to draw your attention to page 142 of that 570-page report, where it has a section 4.3, strengths, limitations, assumptions, and key sources of uncertainty in the hazard and dose response analysis. And in this paragraph addressing this, or at least a partial paragraph, it says EPA has high confidence in the cancer inhalation unit risk and medium to high confidence in the oral and dermal cancer slope factor. I agree with that. I think that's actually very straightforward, and it reflects consideration of many scientists, many peer review steps, including this is a different document, not the one that was developed by the IRIS program that has, again, evaluated the data. And as you pointed out, they came in with a slightly different potency factor that was actually a little higher than the one that the IRIS document had developed. So I just would say that, in my view, we can dig into the data here, but I think that's not going to be a very fruitful effort, in my opinion. So I'm comfortable with what we did. in our discussions back in April and again in October, and feel that the original language that we came up with was appropriate for consideration here in voting. That's my comment.
Thank you. Folks on the line, any perspective to share on what, if any, qualifiers you're comfortable with on the cancer slope factor, including the one that's on the floor for discussion, or questions for Tom or follow-up questions for John?
This is Elena. I have a couple of comments.
All right, we can hear you.
Okay, this goes back to the modifier exceptionally large degree of uncertainty. I'm not sure I know what exceptional actually is. And I mean, that may sound too nitty gritty, but it just seems like, I mean, for things like clear evidence of carcinogenicity and when data is being looked at, you have a definition of that. I don't know if I don't have a definition for what is generally regarded as exceptional. As in, would a reasonable toxicologist who looks at data like this say it's exceptional? I don't know that there's such a definition. So I'm not sure that the wording might not add confusion. And the other thing I would say about comparing other assessments is that basically it's very limiting on one level, because you're limited to what chemicals have been evaluated via the IRIS program, if we're talking about, and have, passed their peer review, and meaning that they used acceptable methods. And it you really are, each chemical, you have an individual amount of data, a set of studies, and it's going to vary, as is, the effects you see, the mode of action. So I'm not sure I'd really think that was all that informative. So that's all I have to say, and my voice is going, so I probably won't.
We appreciate your being a trooper and joining remotely when your voice is given out. We were able to hear it.
Thank you.
I'm going to leave the space open for anyone else online for a minute before I open it back up to everybody, including those in the room. If there's anybody else online that has a perspective to offer on the alternate language that's on the floor, or a question from anybody who's spoken so far. I give a lecture at NC State every year in wildlife toxicology, and at Duke in wildlife toxicology. And there's a couple of exercises embedded in the middle. And I ask questions, and there's supposed to be a back and forth. So I usually just take a long drink of water and wait. Eventually somebody starts talking. But no one has to in this instance. I just wanted to make sure you knew that the floor was open for it. So now I'll say it to anybody, those online as well as those back in the room. Confident everybody online had a chance to speak. Detlef?
Yeah, since I couldn't join in October, I thought I'd weigh in. I do share Tom's concerns in the sense that there could be better data and data that could make the cancer slope factor more certain, but we don't have those data currently. generally I teach my students to not use too many adjectives in scientific writing. So I also share Elena's comment on, what does exceptional mean here relative to maybe uncertainties that we see in other assessments where, like you pointed out, Tom Augsburger, the many uncertainty factors that we often build in that can add orders of magnitude changes to the values that we end up with. So the word uncertainty is already in the original language, and I'm not sure that we need to add too many adjectives to it. Tom Starr pointed out to me that the uncertainty could mean that the cancer slope factor based on other data in the end could be lower or higher, right? And I think I would very much be in favor of conducting another study that would capture that lower end of the tumor incidence rates. So that's my current thinking here.
Thank you, Detlef. Other perspectives or questions?
Well, can I say a couple words?
Sure, of course.
Okay, I struggled with the word exceptional, and my thinking of the right word to put here was colored by the fact that what I wanted to say was out of the ordinary, not the usual kind of uncertainty that you see in what I would call everyday iris risk assessments. And if you want to change exceptional, or I'm certainly open to changing the word, I think more than ordinary, higher than ordinary. I mean, in the same way, you could use the word high as John used to characterize the confidence EPA has in the inhalation studies and the cancer slope factor that comes out of them. The high degree, exceptionally high degree of uncertainty, or well, not exceptionally, but the high degree of uncertainty surrounding this cancer slope factor.
Thank you, Tom.
I'm open to changing that.
I think if I'm right, though, what John was reading, and you'll have to read it again, said that EPA called the oral cancer slope factor that they were moderately confident in.
They were medium, is what they said.
Medium to high confidence.
Yeah,
in
I
the
really,
oral and dermal slope.
Well, just read it again so that we characterize it right, because they said inhalation and oral, and the oral is the one that we're struggling with. So this is just for context, a different group of EPA, but using the exact same data set. What is that, 11 years later?
Right.
And they modeled it a slightly different way, but this is their conclusion.
So again, this is on page 142 out of 570 pages from the Office of Chemical Safety and Pollution Prevention report from November 2024. It says EPA has high confidence in the cancer inhalation unit risk and medium to high confidence in the oral and dermal cancer slope factor.
Okay.
I might go on just to say that there is more information here that I didn't say, but it says key sources of uncertainty. There's another sentence. Key sources of uncertainty include limited data on some sensitive reproductive and developmental endpoints, reliance on root-to-root extrapolation, uncertainty around the mode of action for 1,4-dioxane carcinogenicity, and the potential for subpopulations or life stages with increased biological susceptibility to 1,4-dioxane. Because my point is that there are areas of uncertainty. They didn't point specifically to the modeling and the evaluation of the data that you're referring to so much. It does say uncertainty around the mode of action for 1,4-dioxane carcinogenicity, which has been an issue there. But again, that's what this most recent report says.
Any other perspectives on this before we move to a vote on accepting the language that's been proposed as alternate language or not?
This is Jamie. Can you hear me?
Okay, I heard Rich and then I think Jamie, but I might be wrong. But let's start with Rich and then I can just ask one at a time if there's any comments from people online so we don't miss anybody since we can't see your hands or faces. But Rich, go ahead.
Yeah, I also didn't like particularly the word exceptional. So that part I think would definitely need to be changed. But what I'm wondering is, I mean, and I'm not, a cancer risk specialist or slope factor specialist by any means, but I guess I would ask maybe particularly John, is the degree of uncertainty around this particularly slope factor, is it unusually large compared to other ones you've seen?
Thanks, Rich, for the question. I would say that a lot of the IRIS assessments struggle with dealing with limited data, and this is the case here. The process, however, is that an evaluation of multiple models and multiple data sets is the normal process. And then the result is to take that to peer review and have peer reviewers, independent peer reviewers, comment about that and then reflect those revisions as well. So I can't say, and kind of like Tom said, I can't say that I can go back through all 600 or so IRIS assessments and say this one is normal, because there rarely is a normal one. This one did strike me a little differently because it selected to use the point of departure approach, meaning the 50% level is closer to the actual data set than the 10%, which is oftentimes used for benchmark dose modeling. But the rationale is that that is closer to the point of departure. If you look at the actual benchmark dose and the lower limit on the benchmark dose, what you find is that it's within a factor of 2 or 3, which is very common for many of the IRIS assessments. That gives some sense of the strength of the evidence. There's about a factor of 2 to 3, and that's very, very consistent with many IRIS assessments. What's different here is it is using the approach to use close to the point of departure for developing the slope factor. So I can't say whether there's other chemicals that have done that. I just don't know. I can't speak to all the many hundred of them that have been done. So I hope that kind of addresses your question the best I can.
Yeah, thank you, Tom. I appreciate it.
And I'll just, because there was somebody else who wanted to speak on the phone, on the online, I'll just run through people. And if you have anything else to offer, just go ahead. And if not, just say that you're good now. How about David?
Nothing for me. Thank you.
All right, Gina?
No questions or comments.
Gotcha. Jamie?
Yes, I had a kind of a question, clarification, and comment. Can you hear me okay?
We can.
All right. So first, with respect to, and John, maybe you can chime in to make sure that I'm characterizing this correctly. My understanding of the confidence levels that the US EPA uses in its assessments is that these actually have a numerical basis or some sort of a definition that is followed. So it's not, we're medium confidence. There's actually criteria set up to establish those degrees of confidence. Is that correct?
I would like to say that I know, but this again is the document that was developed by an office that I'm not part of or was not part of. So I don't know that they have that. I'm sorry to say I don't know.
Yeah, I think this comes from the weight of evidence characterization. So I do believe that there are some very, the definitions are anchored so that those confidence assessments have something behind them other than just a subjective adjective. I also think that in the slope factor, uncertainty is captured because of those 95% confidence limits. And in my opinion, the word uncertain is good enough. I'll be a little bit crass here. It's sort of like pregnant. If you're uncertain, you're uncertain. If you're pregnant, you're pregnant. And adding in degrees doesn't really do anything to strengthen or weaken the degree of uncertainty. And I also think we have to be a little bit cautious or aware of how we characterize the uncertainty will be viewed by the public, because certainly we want the public to be confident that the recommendations that we're giving to DEQ and DHHS are shared by us in terms of consensus and confidence. So I think we have to be a little aware of the public view of what this might convey.
Thank you, Jamie and Elena. Anything else from you? We got your comments earlier. I'm just providing space since I can't see people's hands or faces.
Yes, just that as a point of information, yes, there are specific for low, medium, and high confidence, and this would apply within both offices. There are criteria for how you judge something to be low, medium, or high, and those are documented. So it does have a specific meaning.
All right. Any further discussion before we move to a vote? While you're thinking about whether you have any further discussion, I'll just note that the discussion's been helpful. I mean, it was a science issue. We're a science board, and the charge was the scientific reasonableness. So good discussion. I remind people that the end of all three iterations of this document has the same bottom line about concurrence with the scientific reasonableness of the state's approach and findings. And then all three versions conclude with a reference to the recordings for granularity. It's a 1.5 page summary. It's actually closer to a 1-page summary that tells people, you know, for the granular details, you can get a lot more from those recordings. So the fact that we've had the discussion is good because it's on the record now of a variety of perspectives, which is oftentimes the way that science works amongst uncertainty. So the granular details will be captured. We're just struggling with how we characterize the big picture for the response to the charge. And now I'll say anything else before we would move to a vote on the motion that's on the floor.
Yes, I just have one more comment to make about John's reference to the upper and lower confidence limits on the benchmark response or the dose at which you start extrapolation. You know, those confidence limits are valid only if the underlying model that's used to generate the dose response curve is the correct one. All bets are off if it's not the correct one. And in this case, none of the models fit well. I can't remember if it was 6 or so, but all of the other models had p-values of less than 0.1 in terms of adequacy of fit. The log logistic model had a p-value of 0.14, which is not far away from 0.1, and you could round down to 0.1 if you wanted to. So the assumption, without justification and with precious little justification in this particular case, that underlies the validity of those confidence intervals as they're calculated is that the model is the correct one. Now, I have no way of knowing whether or not the log logistic model is the correct dose response all the way down to 1 in a million risk, and nobody else does either. So it's a very shaky situation to be in, and I think it needs to be singled out in a way from whatever else IRIS has done in the past, unless you can point to another situation where it was this bad. I think the uncertainty here is truly exceptional in the sense that it's out of the ordinary. And I'm willing to entertain some other word. Maybe it should be some of the out of the ordinary degree of uncertainty or something along those lines. But I think there needs to be some note that this is different. This is different from the others. and that's my opinion, and I'm going to stick to it.
All right. Well, we've had a discussion about the overall, sometimes uncertainties and risk assessments, the weight of evidence that's available here with multiple studies, cancer found in 2 species, EPA taking the data for the lowest doses, the fact that some of those doses were, the response was high at those doses, they're modeling it accordingly. The versions of the document that was available in October says the IRIS document has documentation of study selection, model fitting issues, and uncertainty for this cancer slope factor. And the motion on the floor that I guess we'll vote on now is to add some of the exceptionally large degree of uncertainty surrounding the cancer slope factor. So the sentence would read, the IRIS document has the sentence before is, I guess, important that the hazard assessment of the 2024 DEQ risk assessment used the IRIS assessment's oral cancer slope factor. The IRIS document has documentation on study selection, model fitting issues, and some of the exceptionally large degree of uncertainty surrounding this cancer slope factor. That's the motion.
That was the motion. I thought the motion was just, are we going to discuss it? Not, are we going to vote?
That motion passed, and we've been discussing it.
But if somebody, you're offering the motion now, consider this language. I wasn't sure that motion was offered.
I'm stuck. I think if we were discussing it, we have to close it out.
Right,
that's how my view of it is.
Okay. Are we taking a vote now? What are you doing?
I'm thinking on my feet.
Motion to close it off.
I guess maybe that would be clearer to John's point. I figured that once we entertain the motion to discuss it, that would lead to a vote on, but we did vote to discuss it. So maybe now we need a motion on whether or not to change the language as it was posited. Thank you, John. I'll buy that, and I'll back off and see if there's, what's the pleasure of the group? Is the pleasure of the group to leave it as is, or does somebody want to make a motion to modify it as we've been discussing?
So moved.
You'll have to state it.
I move that we adopt the
microphone.
I move that we adopt the language, some of the exceptionally large degree of uncertainty surrounding the cancer slope factor language.
And is there a second? And from anyone online?
So just to clarify, we're voting on whether to accept this, what's on the screen currently?
No, where we are is Tom's made a motion that we adopt the language, a slight modification of what's on the screen. The motion that he's made, which we don't have a second on yet, is that we would change the language to include some of the exceptionally large degree of uncertainty.
Okay,
So Tom made that motion, and so far there's not a second to bring it up.
A question, like some other of the red text, that's separate from this motion, like the additional discussion on the as well as the board's own additional discussions. Is that separate or all related?
I think that's separate.
Okay.
So pause.
We're just voting on the word some of, if that's what you're saying?
No, it would be some of the exceptionally large degree. That's
Whether
the
we
words that
accept
are
that
added.
part of it, just that part of it.
Yeah.
Okay, thank you.
So I'll just wait about 5 more seconds. We have a motion, but no second as of yet to modify the board's statement crafted in the October meeting to add the words, some of the exceptionally large degree of uncertainty surrounding before the cancer slope factor. Okay, without a second, I think that stays tabled and we are back where we were with the October version of the statement as written. Again, we will modify that to include this discussion, which then becomes a link at the bottom of the, right now the document ends with a link to each of the discussions. For granular detail, this will all be included there. Should somebody want to have that level of detail, so that'll be a modification as well. With that, I think we could move to vote on the October version. The October version was circulated in mid-October for additional comments. We paused on voting on it because there wasn't everybody available at the time. So now we're back to the original version, which hasn't changed since October. Is there a motion to adopt that version as the board's response to charge, with the modification being that it would include a link to today's talk at the bottom?
So the October version is this text minus all the red, or?
It's the version that Franny distributed back on the 25th or October 30th, I think it was.
So I would move with the October language with the addition, as you just stated, with the December discussion link added to it. That's what I would move.
Is there a second for the motion to adopt the language proposed in October with the addition of a link to today's discussion at the bottom?
So moved.
We have a motion and a second. Is there any discussion about the October 30th iteration? All right. Are folks on the phone clear what's going on? I'm going to call people individually for a vote, yay or nay, to adopt the October version of the board statement. It was the version that was crafted at the October meeting. It was subsequently distributed to all members because a couple of people were not at that meeting, but it's been unchanged since then. The motion is to adopt that as the board's formal response to charge, with the addition of the link to today's discussion at the end. So I'll just call on people, I think maybe in alphabetical order. Viney is away. How about DeGiulio?
Yay.
DeWitt?
Yay.
Kenyon?
Yay.
Kimball?
Yay.
Howard?
Yay.
Knappy?
Yay.
Let's see, Starr?
Nay.
Vandenberg?
Yay.
And Augsburger will be a yay. So that passes 8-9. And don't feel bad about not having Viney vote on it, because it was unchanged from the version that he has already seen. If we had substantially changed this, we wouldn't have had a vote on it. So that closes out that agenda item. And Before we move on to agents, the presentations, let me ask, is there a time constraint from any of the first two speakers before lunch? No time constraint? And then how long is the first presentation?
20 minutes,
15, 20 minutes. Are board members okay sticking around for 15, 20 minutes, having that first presentation before lunch?
Sure.
And if anybody needs a break, just feel free to get up and go. But otherwise, let's respect the speakers that are available and we'll have that discussion. So the first item on the agenda for presentations is from the solid waste section. And we're having a presentation on landfill PFAS data. And remind me who we're being joined by today for that.
Absolutely. So good morning still. I'm Jason Watkins. I am the solid waste section chief. I greatly appreciate the opportunity to be here today to talk about our work related to landfills and PFAS. Full disclaimer, and part of the reason why the presentation will be a little bit shorter today, we're not going to dive into data very much. This is an informational, really just to give you guys an idea of what we're doing, kind of how we got to this point, and then if there's a need to come back for further discussion on data or provide you guys data, we're certainly open to that. So with that, we'll go ahead and get started. Just want to give you guys a little bit of background if you're unfamiliar with landfills here in North Carolina and some of the work we're doing and what we've been doing for the last decade. So really looking at the types of landfills here in North Carolina where PFAS would likely be present based on the waste types that were accepted. And so we really look a lot at the pre-subtitle D, the unlined historic sanitary landfills here in the state, industrial landfills, both unlined and lined. Some of those are captive in nature, meaning they're directly tied to an industrial generator, such as a paper mill. We have some industrial landfills that are tire monofills here in the state that collect waste from outside sources. So we have both in that case. We do have construction and demolition landfills here in the state. The vast majority of those remain unlined. We have at least one or two new ones that have been built since 2007 that were required to have liner systems. And then ultimately we do have the lined subtitle D municipal solid waste landfills. I just want to remind everyone here that landfills, much like the publicly owned treatment works that are often codependent on one another, they are passive receivers of PFAS containing materials. They're not producers and generators. Oftentimes that comes into question. And again, the reason why I link those two is they are historically codependent from the perspective of landfills need the POTWs to manage leachate historically. And likewise, the POTWs need an outlet for sludge disposal in many areas of the state. Just for background, PFAS in landfills are regulated across three of our regulatory divisions here in DEQ, both waste, my colleagues behind me in air and water as well. From a timing perspective and really where things got started. And so we started seeing here in North Carolina some early grad student research out of NC State and some other states around the time of 2015, 2016. So slightly in advance of when Comores and other things kicked off here in North Carolina. And really the first state that I'm aware of that really started regulating PFAS was the state of Vermont in looking at least some leachate level restrictions. And I think that original law was in 2016. Around 2018 here in North Carolina, we started requiring sampling of 1,4-dioxane at our landfills, which leads into the 2019 discussion that we met with our industry representatives, primarily our private sector, what we call the big three here in North Carolina: Waste Management, Waste Industries, at the time now GFL, and Republic Services, to talk about the potential presence of both PFAS and 1,4-dioxane in their leachate, and really looking at leachate treatment disposal practices. What came out of that was an industry-led study that's called, we often refer to it as the collective study, that really looked at leachate levels containing PFAS at the large regional privately owned landfills here in the state. At that same time, a lot of work was coming out of NC State and some other institutions related to the same topic and looking at PFAS, leachate, and POTWs. The study I referenced here that just came out this year, Dr. Knappy's the author on that, I believe. That a lot of this data that started back in the 2019-2020 timeframe really drove the results that came out of that study. So landfills and PFAS here in DEQ are a priority or a focus point. You can see that in our PFAS action strategy. Landfills were identified as a potential contributing source to the issues we have related to PFAS, and certainly a large container of PFAS. So that's focused there. It's also part of something you may be less familiar with, and that is our strategic plan for the Division of Waste Management and our Division of Environmental Assistance and Customer Service. We're required by statute to basically produce 10-year plans for how we intend to manage waste and recycling and those type things in the state. And so in our new 2434 plan, which was published in September of 2024, we do have focus areas in there specifically looking at both programmatic changes, but also further assessment work, as well as future potential regulatory changes to address emerging contaminants. So just wanted to point that out. Really getting into when we started sampling here in North Carolina with landfills. And so I do see there's an error here, and on that second bullet, that's supposed to be July of 24. But ultimately in March of 2024, based on a lot of information that was out there, we moved to make a regulatory decision to require all landfills here in the state, all sanitary landfills, to monitor in both groundwater, surface water, and landfill leachate. We made some clarifying things, like I say, 2 months later, 3 months later, based on some industry-specific questions, just for a scope of work of what that universe looks like under the authority of the solid waste section. That's 276 landfills of those 4 previous types that I spoke to that were required to conduct monitoring. And really, we've migrated in EPA Method 1633 in its draft form and now in its final form. And then for landfills that took specific waste from Chemours and some other specific facilities, we do operate under the 537.1 modified method on sampling. Let's talk a little bit about that and really the drivers behind that. So our initial focus was really just to collect the data and evaluate the presence in the environment and really from the management of these facilities. That would allow us to decide, obviously next steps in terms of further potential impacts in the communities around those, but also what is our regulatory framework here in North Carolina? How are we going to move forward? What we did decide was it made a lot of sense because our facilities already monitor groundwater and surface water and leachate twice a year, was to just combine the PFAS sampling with that sampling frequency. It allowed costs to be maintained at a reasonable level and some other things, and that's especially important for our local governments here in the state that may not have been considering those budget implications. So it's taken us a little bit longer to get in a lot of data because we are working on that semi-annual process. So we needed at least really two events. So we did, for most facilities, that was a fall 24, spring 25 sampling event. Some of those were just now getting in the second event before we decided what to do next. Just for reference, all the groundwater reports, as they have been for the last, since we've had the online document system, Laserfish, are fully uploaded as soon as we get them in. So all of the data that comes in from the facilities is immediately uploaded to the website. The data also in its raw form goes into DEQ's EQUIS groundwater system at a very complex level, really to the point where we're breaking it down by a specific groundwater well at each facility, all of the constituents in each of those wells, and really looking at the results for each constituent found. We're utilizing those EQUIS data inquiries for public records requests, certainly, but also to determine those further regulatory actions at the facilities. We're also doing it to try and get a better understanding of, are there specific types of PFAS that are associated with specific types of landfills, specific ages of landfills, those type things, because there may be some correlation that we can take and make other decisions. Just kind of give you a little bit of idea of what that data does look like in one of the reports we can produce out of this. This is a March of this year report. So at that point in time, we did have some groundwater interim maximum concentrations that were there. And so just kind of trying to break that down from a perspective of 3 different types of landfills. So that is a lined municipal landfill, an unlined industrial landfill, and an unlined C&D landfill. And obviously you see the presence of PFAS, and really at a max detect level, you see some pretty significant detections in groundwater at those facilities. One point of interest that may come up here is Alamance County has some levels of Gen X, and that's certainly a facility that's far west of Comores here in the state, and did not take waste from that facility. So where else are we using that data? I think Shushma mentioned it earlier. You may hear a little bit about it more, but ultimately we are looking at a signature tool and trying to create a breakdown of each of the PFAS at the landfills to try and understand, really correlating, is there a clear indication that the leachate in the facilities is leaking? It's getting out of the lined landfills, it's getting into groundwater, or is there potentially some other source? For that, we're also looking at it from the perspective of looking at there again, do we have certain things that are showing up more frequently than others, or are they showing up across specific landfill types, landfill ages, et cetera? So from that, as I spoke to earlier, the next step logically is to look at what is the regulatory framework related to PFAS and landfills. Is it something new, or is it putting it into an existing regulatory framework? So with that data that we've collected, we're working currently under our state groundwater program, and we just made a decision to start issuing notice of regulatory requirement letters to facilities based on those groundwater exceedances for PFAS, really based on a prioritization of the magnitude of those detections, offsite migration if we're already seeing something in surface water, or the potential for offsite, and really what are the receptors immediately around that facility, private wells, those type things. So the first prioritization of the list that went out was in November of 24. We issued 24 NOR letters to facilities that either had the most significant detections of PFAS in groundwater. Those were generally 4-digit and above, or that had an immediate offsite risk, private wells, those type things. We followed that up just a few months ago in September with an additional 53. So we're at 77 right now. So of that 277, we're a little over about a third, a little over a quarter of our total landfills that we've looked at. The likelihood is we may roll out another set of NOR letters to an additional set of landfills here in the spring. But ultimately what those NOR letters required were those updated receptor surveys. They required assessment work plans to really look at potential for migration offsite, and then really looking at, do we need to sample offsite wells, make alternative water decisions, those type things. And if we did in some cases, and I'll point one of those examples out here in a minute, where we saw an immediate offsite risk, the division made a decision to not wait for the facility to take an action, and the division did its own sampling and has moved some folks to alternative water under our old programs. So much like everybody in dealing with this, we are certainly navigating a regulatory change around us as we're trying to implement our own regulatory changes. And so you're probably very aware that our EMC here has recently adopted 3 2L standards, ultimately migrating away from the IMAX, the 8 IMAX that were there previously. And in some cases, in the absence of IMAX, we rely on the PQL for that determination. We're also looking at, continued changes at the EPA level, but also in our other air and water programs as well. Just kind of give you an idea of where we are in the workload here. So we have approved work plans for all of those original 24 landfills. We're implementing those right now with the facilities. I would mention that 50%, so 12 of those 24 had offsite private well concerns, and we are doing offsite sampling, either us or the landfill. And we have probably at this point in time, I think 3 landfills that have moved to alternative water in some shape or form, whether that's bottled water or filtration system, those type things. Our hydro team is working diligently with the facility consultants on the subset 2 work plan submittals. Those are due, I think most of them are due either at the end of this month or mid-January. So we're working on getting those in, and we'll take those to those next steps. And then really there's a lot of, there will be ongoing monitoring at each of these facilities based on the data that we're seeing. There is certainly a lot of interagency coordination going on right now, even within our own division on some pre-regulatory landfill crossover. Those are the landfills here in the state that predate all rules and were isolated out in 2007 Solid Waste Management Act as being closed prior to 1983. Certainly working a lot with our colleagues in water resources as they move to start requiring influent and effluent sampling at their wastewater treatment facilities, and really looking at the biosolids research that's going on here in the department that Shushma spoke to. A lot of work currently going on around landfill gas systems with our Division of Air Quality. Several of our larger landfills have migrated from traditional gas systems where they produce energy off of a generator to the grid to renewable natural gas. And with those new renewable natural gas permits, they do have PFAS sampling requirements. And then really looking at a lot of on-site leachate and groundwater treatment options. And I would mention again, a lot of focused around the cost associated with some of these technologies, and really looking at how that impacts especially our local governments and their abilities to budget the cost of some of these things. We continue to engage our industry, both on the public and private side, at certain landfills, really trying to figure out, are there specific concerns that led to maybe the detection levels that we're seeing? Are there design or construction or O&M things that have occurred at the landfill historically that have contributed to the presence or the level of detection? We certainly continue to work with facilities and our local government leadership and a lot of our environmental groups here in the state on landfill permitting challenges. You're probably familiar with the NIMBY thought process. We have enough trouble here in North Carolina permitting new landfills. Adding PFAS to that conversation has certainly elevated those concerns for a lot of people, and potentially rightfully so. But what that has created is some additional challenges and some additional educational efforts to try and really get everybody on the same page as to what's occurring and what are the next steps to allow landfills to potentially be permitted. That plays a lot into another issue we have here in North Carolina, which is a dwindling overall landfill capacity. So this is an example of a facility that you may very well may be familiar with, but certainly a lot of cross DEQ coordination in dealing with this facility. This is the former Waste Industries, now GFL, Sampson County landfill. This is a facility that has 4 separate landfills at this location. There's 2 C&D landfills, one closed, one open, 2 MSWs, one unlined and one lined. This facility also has a historic, now inoperable leachate evaporator system that was used at a point in time. So our GFL in this particular case was already working on a reverse osmosis system approval with our Division of Water Resources for leachate. And at the time when that first started, it was not related to PFAS. It was more related to the fact that they're produced, because it is the largest landfill in the state, they certainly produce the largest amount of leachate, and the wastewater treatment plants were certainly having trouble keeping up with that. And so GFL moved to a alternative system, which has now incorporated PFAS into those discussions. When you take into account our original sampling protocol and the information that we started getting back in groundwater contamination, this is a facility where we took an immediate approach as a division and as a department to go out into the community, do our own sampling, held public meeting, and looked at 30 private wells sampled 30 private wells within 2,000 foot of that landfill. Some of those immediately went on bottled water. There were and probably continue to be discussions with the county, both on with GFL on the possibility of a water line extension into some of those communities. Likewise, as I mentioned earlier, there's a lot of focus as well on the evaporator system and the potential for whether or not PFAS was generated from that. DWM staff conducted additional sampling within the soil sediment and surface water in the adjacent Bearskin Swamp. Part of that was for some validation purposes. So there was a study that came out, I think in draft form in late 2023 or 22 or 23 from Dr. Courtney Woods over at Carolina in their environmental sciences group, where her and some of the environmental groups had done some off-site sampling within Bearskin Swamp and raised some concerns about could the landfill be contributing to some issues over there. And so we did a lot of work to try and duplicate what she concerns that she had raised and her group had raised. Ultimately, GFL did submit updated receptor survey information. They've installed additional piezometers at this facility to better understand overall groundwater flow. We decided to move forward with a NOR letter to that facility, primarily focused on one particular area of groundwater. So this is a facility based on its location and the soil types and the groundwater table around this facility. It essentially has, in layman's terms, a French drain underneath the landfill, a gravity-fed groundwater intercept system that was meant to prevent water from ever coming up close to the landfill. It's meant to keep it at a substantially lower level. That groundwater system had, it's a fairly high flow system, and so it moves a lot of groundwater through that location and through that whole area. It had significant levels of PFAS in it, and so we took immediate steps to take additional assessment on that and get some action in that as well. And so with that came a plan to put into place a treatment system specifically for that GGI groundwater as an on-site system. That moved quickly to a joint effort between the Division of Waste Management and our colleagues in Water Resources to draft a special order of consent to move that treatment system under an NPDES permit. And as noted, our Environmental Management Commission just approved that in the November, that agreement. So that system should be going in, and hopefully we will be seeing significant reductions in PFAS in groundwater at the facility. With that, I may have run a few minutes over my 15, but happy to take any quick questions I can, and I'll free you guys up.
Thank you, Jason, for the presentation, and thanks for your solid waste stewardship, the facilities themselves, and then also the surrounding receptors. It's important work. Are there any questions from panelists in the room or those online? John has one. John?
I sensed a sense of surprise about Alamance County and the Gen X presence in the landfill leachate there. Are there other surprises that you can point to now?
So the one thing that I will say is not a surprise is that there's PFAS in landfills. I think we kind of all understood that. I think the levels of detection that we're seeing in some cases are certainly a surprise. I think we
very high in what you showed there for at least the maximum.
Yeah, and so I think again, primarily a lot of the focus around Gen X and that topic has been in the southeast part of the Cape Fear River Basin. And with few exceptions, you wouldn't expect it to show up throughout the state. And so when we look throughout the state, there are several other facilities other than Alamance County that do have some detections of Gen X. And so I would say that is certainly a surprise and something we're looking at in terms of, was there a specific waste type or another industry that may not have been a producer like Chemours, but may have been a heavy user of a Gen X based product that then went to that facility. So that's certainly something that we're looking at.
And those data are available, or they will be available?
Yeah, so every bit of the data that has come in is readily available right now in the existing groundwater monitoring forms on Laserfish. Take a little bit of time to maybe dig through those for an individual to do it. That's why we're trying to migrate everything over to the Equus system so that we can more quickly pull that data in a form that makes it more usable faster. Right. And so again, if there's a specific ask there, we're happy to try and fulfill that to the extent we can at this point.
Yeah, thank you very much.
Absolutely.
Detlef?
Thanks, Jason, for the presentation. I'm curious, are you also looking at old dump sites, like unlined, closed dumps that may be impacting groundwater and private wells.
So again, my focus in the solid waste program has been the 276 that I have under my authority. Michael wants to speak. Bill Honeyke's here in the room. He's our Superfund section chief. Michael, our division director, may want to speak to that. But to your point, yes, the pre-regulatory landfill program is looking at some of those other landfills that we have in an inventory. Obviously, if there's landfills out there that we don't know about, we can't look at those. But for everything that's in our inventory, I do think there are efforts migrating in that direction to do that type of assessment work. They're shaking their heads, so I guess I answered that appropriately.
Always good. Questions from anyone online for Jason? All right. Well, thanks so much for the presentation. And these presentations will this be among those that get posted online for the, as part of the meeting minutes? Okay.
Thank you very much for your time.
Good. So for anybody else that wants to go back and look at the granular detail, they'll have it. So are we going to be okay if we pause for lunch now and pick up on the Beard Allen program presentation afterwards? You can join us afterwards. Are you sure? I mean, it's a question because we can power through if you want.
Go ahead if you want. I'm open. I can go through now, try to expedite things, or do I have lunch?
I think after lunch is probably better as long as it's going to be okay with you, just because folks have been sitting here for a while. So, but we'll try to stay on schedule and rejoin promptly at 1. So I'm going to encourage the board members to come back maybe about 5 minutes till and get set up so we can start promptly at 1, and we'll have your presentation queued up then and look forward to it. Before we break, I wanted to thank people for this morning's discussion and remind everybody that science is a process of questioning, and that the evidence is often incomplete, and that disagreements in science are not only common, they are essential. Essential. So I want to thank Tom for bringing a science issue to our attention. The fact that it's, not a consensus vote is largely around the language that's used as opposed to overall feeling. And I just wanted to point out that I think it's important again, and it's kind of expected for those of us that have published papers. You send something to a journal, 3 people say it's good, 1 person says, I'm not sure I buy it. I think you need to go back and do some more work. And then an editor has to make a decision. So disagreements in science, as opposed to other fields of endeavor, are not only common, they're essential. Science is a way to make inferences based on data and evidence. So thanks, Tom, for bringing it to our attention, and thanks everybody for participating in the discussion. I think it's a good resolution of that topic. So we'll break for lunch. We'll come back a little before 1 to be able to stop promptly at 1. And I'll remind people that mics are probably live, so if you're going to be somewhere around here. All right. Thanks, everyone. I'm going to call us back to order for the second half of the meeting. And the next informational item also comes from the state's Division of Waste Management on the Bernard Allen program. Which one do I use to advance?
Just the arrows.
Yep. Okay. Thanks for joining us.
Thank you for having me. So I'm here. My name is Vince Antrilli. I'm the supervisor over sampling unit and Division of Waste Management, and oversee the Bernard Allen program. I just want to give you a little quick brief history of the program. Started in 2007 with the intention of sampling wells and sending notifications to folks within 1,500 feet of a known and or suspected groundwater contamination, and to provide alternate drinking water for those who are exceeding drinking water standards, and then monitoring those alternate water provisions, annually. Qualifications for use of the fund. residential private wells, they must exceed the federal drinking water standards and 2L standards if there's no federal standards that apply. The contamination, can't have been caused by the property owner, and it must not be a business or a corporate entity. Well owners must meet a financial qualification for use of the funds, and that's 3 times the poverty level. The poverty level is produced by DHHS annually, and so we update that. In 2022, the legislature modified the Bernard Allen statute to include provisions for PFAS. Keynotes to the changes were a removal of the income limit for PFAS contamination for dealing with those. And then the contamination limits expanded to include DHHS health goals and EPA advisory, for advisory standards for PFAS. At the time that this was changed, there were no MCLs established. As far as a basis for treatment needs, our program uses the current MCLs. We're cognizant of changes that may be coming down the line, and we'll make the appropriate adjustments as such. Recently, November this year, the state 2L standards have went into effect. You see the standards. But as far as enforceable standards, we're going to be using the PQLs for PFOA and PFAS. This is covered by Jason earlier in a different presentation. Risk communication. So when we have a detection of PFAS, we communicate the risk to the homeowners through a letter. We give them a copy of the lab reports and a copy of the understanding PFAS fact sheet produced by DEQ. For owners who have exceedances of any drinking water standards, the EPA standards that would necessitate alternate water, we have a phone call with them before they even get their copy of the results and the letters from us. And we talk through the results and the alternate water options at that time. We kind of shortcut the process. We developed a program in 2023 based on the requirements of the statute where the income levels have been removed. But in keeping with the intent of the Bernard Allen program to help those most in need, we have different levels of service we provide to homeowners who have exceedances of PFAS and MCLs. So those who met the original qualifications under 3 times poverty level are entitled to a point of use RO system, and we installed K5s. And so, but if the homeowner who does meet those qualifications wants a different system, they can put it in and apply to our program for a reimbursement. Homeowners with exceedances that are over the threshold, the 3 times poverty level threshold, can install any system that they choose and then apply to a program for a reimbursement. In this picture are a couple examples of a whole house point of entry system. This is a system that we typically install for our non-PFAS program. And, that the whole house system that people install, they vary widely. It's not necessarily a standard large carbon tank system. Different manufacturers have different types of systems. Then to the right, you'll see the Connecticut K5 and an Aquasana reverse osmosis systems. Those are pretty often installed in homes. Filter questions. With regard to filter, some of the questions we know is, what kind of filter we need, what is effective against PFAS, and we convey to people that RO systems are point of entry systems that are very effective at removing PFAS. Granular activated carbon systems, whole house systems are also very effective at a higher cost. And then the ion exchange technology, which is basically not real applicable for home use. It's just too expensive, and the technology isn't really scalable to in-home use. So point of use systems, again, the benefit of those is they're small, they're affordable, and they're not very costly to maintain. Installation of these systems can range anywhere from $500 to $2,500. Depending upon the system and the manufacturer of the system itself. Whole house systems will range anywhere from $1,000 to $8,000. Again, a lot of the cost variance is manufacturers, the type of carbon used, the size of the tanks. A lot of variability there. We try to, when we're having conversations with homeowners, we talk about all the variances, variables on these systems. And if there's a system that we're not familiar with that they want to go with, we let them know that, prior to sending out any kind of reimbursements, we're going to want to test the system, make sure it's working properly. If they would like, to send us a copy of the spec sheets and a model information, our staff will be glad to, review the system for performance for PFAS removal, and then we give them the data, and it's up to the homeowner's decision as far as if they want to proceed or not. So in general, things to consider when installing a filter system are the purchase price, the membrane type, installation costs, and then ongoing maintenance and service. As I mentioned, we put together a program back in 2023. There's an application with that, and when we talk to homeowners and we send out the data with their exceedances, we send a copy of this application out for their consideration. And the application is also available online on our website. For those who aren't in that initial conversation, maybe they have data from some other sample source that they want some alternate water provisions and want to apply to the program, it's available. Work that we've done in the program. You can see this chart shows basically the alternate water that we provided over the life of the program. And up till 2023, most of our work was non-PFAS related. We were given a couple of appropriations, non-recurring appropriations over 3 budget periods or 3 individual years. And that was $900,000, which we've now exhausted. But you can see a spike in, our activity as far as, the treatment systems and bottled water that are put in place, and then also reimbursements. Well sampled. So our program has sampled over 8,000 wells now. These numbers are as of the end of October, over 79 counties. We're one of the few programs that operates over the whole state. We're not, east-west. We operate over the whole state. The bar charts show our sampling activity per year, and you'll see those orange the bars represent the PFAS activity. Again, that's through end of October this year. Alternate water provisions. We provided alternate water, whether it be bottled water, point of use systems, point of entry systems for PFAS and non-PFAS exceedances, over 44 counties in the state. They're asterisked by the received bottled water and point of entry installer maintenance, because those where we've installed point of entry systems for non-PFAS activities, we maintain those systems annually. We do not maintain the point of entry systems or point of use systems for PFAS because we don't have recurring funds, and the funds that we were provided have now exhausted. So we tried to use those funds to deter the costs or help people out, help the most people out with their costs by not providing maintenance. So another question we get is, where do we get our sites to work on? Well, initially, a lot of our work were with inactive hazardous sites across the state. And that was mostly for our non-PFAS activities. Since PFAS came around, We took a look at those sites and evaluated, which sites are what industry, and we started to prioritize PFAS sampling at those sites based on the industry type. This is a map of our EQUIS data for PFAS. All of our PFAS data we receive goes into EQUIS. We're able to produce these maps, thankfully, for the help of Jared here. And this just shows the Bernard Allen activity throughout the state as far as PFAS exceedances and non-exceedances. Other sites, we get sites, we work with other agencies within DEQ, the IHSB, not just IHSB, but Division of Water Resources, UST, and Hazardous Waste, where those other agencies don't have funding to provide alternate water. They come to us and we can help out with alternate water provisions and sampling as needed. The beauty about the Bernard Allen statute is that it was written vaguely and not relegated to a single section in Bernard Allen, which gives us the ability not just to work with other sections in the state, but also directly with EPA, other counties or municipalities. They're doing their own research on sampling. They can refer sites to us and we can pick it up and offer sampling and alternate water to folks at no cost. Recently, last spring, Division of Water Infrastructure approached our program because they had received a grant, part of the Biden-Harris improvement grant, to provide alternate water provisions and tackle exceedances of PFAS in the state where to deal with homeowners, individual homeowners. And that's not something that they had typically done. But Bernard Allen program has been dealing with individual homeowners, since the inception of the program. So we're working with them, and there's a fund allocated that we are administering. And a lot of that, a good portion of that fund is going directly to waterline extensions for PFAS, where there's PFAS exceedances. I'm working directly with CFPUA and Sampson County Utilities on a few projects. We're going to use that money for sampling the smaller and underserved communities. That work has started, but currently being funded by Bernard Allen General Appropriations. We're waiting to use the grant money once they get their CLAP document approved by EPA. We're waiting for those monies to be released. And we will extend the PFAS reimbursement program, but using the funds from this grant, we can only provide alternate water to those meeting the lowest income threshold. And those are just provisions of that grant. So I've been with the Bernard Allen program for, over 15 years, 16 years, almost since the inception of the program. We've dealt with non-PFAS activities. We started working with PFAS activities. Our early focus was in the southeast part of the state, addressing wells, sampling wells where Chemours do not sample, providing alternate water to those who didn't qualify for Chemours actions. And then we expanded to deal with sites across the state that based on their industry. Now we're working with the EPA grant and DWI, and we just look forward to our next opportunities. I want to go off script a little bit and talk a little bit about some of the other work that we're active on and have been active on. Jason had mentioned about the landfill down in Sampson County. Bernard Allen program was very integral in a lot of the additional sampling outside of the, not just within the parameters of 2,000 feet of the landfill, but beyond that. And identified a large area of contamination where we still don't have a source. We're working directly with the homeowners with providing alternate water, working with Sampson County Utilities on waterline extensions using that grant. We've also been working heavily now over this last week in efforts around the Pleasant Garden project. We've got teams out there right now conducting sampling that came together pretty quick. There are other division initiatives that we address very quickly. Swepsonville is another area that we've addressed. So that's about it. If anybody has any questions.
Thank you, Vincent, for the presentation and then for the 15 years of service in the program. That's awesome. Thanks for both. I have a question, but I'll open it for anybody in the room first and then anybody online. So how often are practical quantitation limits updated and who decides? Because if there's a standard of X and a practical quantitation limit of Y, and the way science works is those numbers, will go down with time probably as people discover new analytical chemistry techniques or better equipment or take larger samples or have new kind of prep. So how often does somebody turn the crank and says, now these are the PQL?
That's a good question. Something that I haven't really been very involved in. We haven't actually applied the PQLs as a decision factor since there are MCLs available. Again, if MCLs were to go away, then we look at the state 2L standards. And, we would apply the PQLs as necessary to meet those decisions.
I got you.
I'm sorry.
Yeah. Thanks for the question. Michael Scott, Director of Division of Waste Management. As Vince mentioned, the Bernard Allen program is really hinging on those maximum contaminant levels. It can refer to 2L levels. So if we're talking about, in general, practical quantitative limits, those are determined at the respective lab. So you will see one lab may have 2 PPT for a compound, the other lab may have 4. So the short answer is it's up to the respective lab. We, in general, have PQL levels that we're kind of looking for based on all of our work for PFAS, but the real answer to the question is it's lab dependent. On the PFAS front also, as Vincent mentioned, Bernard Allen hinges on MCLs first. They can look at 2Ls. We now have PFOA, PFOS, and Gen X have established levels for PFAS based on the Environmental Management Commission's recent decision. All other PFAS, the thousands of them, default to PQL. So, that's the rule language as we have it now. But yeah, great question. And it can vary between labs.
Thank you. Any questions from any of our panelists that are listening online? And then I'll close by saying any questions for the other panelists in the room. Detlef?
Thank you for the presentation, Vincent. I'm curious, I think the one question already got maybe answered. If EPA gets rid of the Gen X MCL, the 2L standards are basically in place to keep the 10 nanograms per liter criterion for the Bernard Allen Fund?
Yes.
Okay. And then the other question is more related to whole house filters. In a study that we did, we found that there are actually quite a lot of whole house filters out there that are not very effective for PFAS removal, and they're quite expensive. So when you talk about whole house filters for PFAS, are you talking about those larger activated carbon filters, or how do you decide what constitutes, or do you have a list of filters that people can choose from? How does that work? Yeah.
So when we have the conversation with homeowners, we recommend granular activated carbon systems. And even when you're talking about carbon, not all carbons, created equal. We recommend, looking at the Calgon F400, F600 carbon for use in those systems. We recognize that there are different systems, different media, different sizes of tanks, different costs. We tell homeowners, look, you can do your research. If there's questions, submit the information to us. We'd be glad to review it. Even go to, talk with the manufacturers about their data, their spec sheets on these for PFAS removal. So we will get into, each of those systems to provide the homeowners feedback on whether we feel comfortable with that. and then our recommendations.
Mhm.
But ultimately, it's a homeowner's decision. And again, before expending any funds for reimbursements in those cases, we tell homeowners straight up, it's like, we're not familiar with this. We've done some research. We're not necessarily comfortable with it. We're going to provide, we're going to sample the well post-filter to verify its usefulness.
Mhm. And maybe it's kind of a little bit of a question of who can benefit from this. If I saw that for the low income bracket, so less than 3 times the poverty level, only POU devices are eligible or are basically installed, but the higher income bracket can install whole house filters and apply for reimbursement. Is there then a cap on how much can be reimbursed, because the whole house filters are clearly much more expensive in most cases?
Right. So the folks that meet the qualifications, the under 3 times poverty level, they can install a system, but we're offering a point of view system at our cost. So there's no out-of-pocket cost for the homeowner. If they would like a whole house system, they can install a whole house system and apply to the program for reimbursement. We do have a table that provides more reimbursement for whole house systems and based on the income level. So I believe we allow up to $10,000 reimbursement for those who meet the lowest financial requirement for a whole house system, and $7,500 for those who are exceeding the standard. For point of view systems, if that's the selected amount, we allow up to $3,000 for a point of view system for the lower income, and $2,250 for those who exceed the income standards. So, and in the application, it's all spelled out to them, and there's a chart that tells them what they would qualify for. But we don't tell people who are, meet the lowest income criteria that, you're out of luck. They have the option as well as anybody else to install a whole house.
Thanks for clarifying. Yeah.
Okay, last question, then we'll move on.
Yeah, I used to work for the government for many years, and so I'll preface my comment with that, is that this seems to cover both water management and waste management, because you're in the Division of Waste Management, correct?
The program, Bernard Island program, actually initially started under Division of Water Resources and managed over there. In the reorg in 2007, it was switched over to Division of Waste Management, which is where I came on, working over in Oberlin Road. So that's the early part of the program.
But it seems like your focus is really on mitigation of identified problems for different communities, and again, the different criteria for putting in systems to mitigate people's exposures. But how does that relate to what the water folks are doing? Are they also monitoring, or are you using the same data?
We're using the same data. So we're more of the sampling arm for the different project managers, whether it be waste management, water resources. We do a lot of the sampling for both. There are based on income, or not income, but appropriations, limited funds available to the program. We may have to, shift focus on what our actions are, where we go to sample, who gets the benefit of sampling. We would love to just say, hey, statewide, hey, whatever, we can sample everybody. But yeah, again, going back to the statute was written so that it doesn't fall under one program. I just happen to work under Division of Waste Management, but could easily work under Division of Water Resources or standalone.
Well, I think it's actually good that you're coordinated across different departments or divisions like that. So thank you very much for your presentation.
Thank you.
Yeah, it's excellent. It's good to see the risk reduction component that comes from standards, action levels, all the discussion, reduced exposures. Thanks again.
Thank you.
Our next presentation is on a topic that was touched upon at the last meeting. At the last meeting, we got a taste of the state's Division of Air Quality's comments on greenhouse gas vehicle standards. And following the October meeting, we sent a copy of the state's September 22nd letter signed by Mike. So the board members have seen that letter. We got a taste of the overall action from Sushma, and we appreciate you being present today to give us a deeper dive. So we have Mike Eberzinskis, the Director of DEQ.
All right, thank you, Mr. Chairman, and good afternoon, everyone. Thanks for the opportunity to be here today. My presentation will focus or give you a little break on the PFAS programming and focus instead on one of EPA's most controversial proposed actions so far in 2025. Not getting any response on the slides here. Let's try that. There we go. And that is the recent proposal by EPA to repeal the 2009 greenhouse gas endangerment finding and repeal all GHG vehicle emission standards. So my presentation will focus on our division's technical analysis of the proposal, and that technical analysis informed the comment letter that you all have already seen and we submitted to EPA on the proposal. So a bit of background before we dive deep into the presentation. I want to remind everyone of what the 2009 GHG endangerment finding is and why it's important toward regulating greenhouse gases and generally air emissions under the Clean Air Act. Okay, so Section 202A of the Clean Air Act enables EPA to set emission standards for new motor vehicles and engines when the administrator determines that the emissions of an air pollutant from any class of vehicles causes or contributes to air pollution that endangers public health or welfare. So in 2009, EPA issued an endangerment finding, and there EPA determined that the current and projected concentrations of 6 well-mixed greenhouse gases in the atmosphere threaten public health and welfare for current and future generations. EPA also issued a cause and contribute finding at the same time, and there EPA found that the emissions from new motor vehicles and engines contribute to the GHG pollution that they determined endangers public health and welfare. So from that, EPA proceeded with regulating greenhouse gases from vehicles. So you've seen a couple iterations of those GHG vehicle emission standards over the years, the most recent of those being promulgated in 2024. There was one set of GHG vehicle emission standards for light and medium duty vehicles and another set for heavy duty vehicles. And both of those regulations were to phase in with 2027 model year vehicles. Now, today, I'm not going to attempt to explain EPA's rationale or legal justification for the proposed repeal of the endangerment finding, which relies heavily on recent Supreme Court rulings. But I am going to share with you what the potential impacts could be in North Carolina should EPA repeal the associated GHG vehicle emission standards. And so this is information you're not going to find anywhere else because no one else has done this analysis, including EPA. So one quick slide summary of what EPA is proposing here with a little commentary. We noted that EPA is proposing to repeal the 2009 endangerment finding and remove the associated GHG vehicle emission standards. While EPA's proposal purports to be limited to motor vehicles, my opinion here, I would say the proposal's questions and rationale will likely further destabilize other GHG regulations as well. More to come on that in weeks, months, and years ahead. But here, EPA explicitly states that they are not revisiting the vehicle emission standards for criteria and toxic air pollutants as part of this proposal. However, they fail to quantify the real-world impact of removing the GHG vehicle emission standards on non-GHG pollutants. They don't explain how removing future zero-emitting vehicles from the fleet and replacing them with fossil fueled vehicles will not increase NOx, VOC, and PM 2.5, for example. So it's important to kind of look back at some historical context as to how EPA has set vehicle emission standards. EPA previously used an integrated approach to set standards for multiple pollutants to optimize overall emission reductions. And manufacturers also did not take a siloed approach when trying to figure out how to comply with various vehicle emission standards and corporate average fuel economy or CAFE standards. So for example, for CO2 emission standards, they are most closely tied to fuel consumption and fuel efficiency. Whereas NOx, VOC, and PM2.5 vehicle emission standards also depend on fuel consumption and fuel efficiency, and also on emission control systems. EPA didn't explain or really how or what the impact would be from really peeling away the GHG vehicle emission standards from the criteria emission standards. All right, so separate and apart from this proposal, earlier this year in the One Big Beautiful Bill Act, that action reset the maximum civil penalty that the National Highway Traffic Safety Administration, or NHTSA, could assess for corporate average fuel economy noncompliance to $0.00. So essentially, this removed NHTSA's ability to enforce CAFE. So the question then becomes, how will the automakers respond to all of this? Well, if you kind of look at things from the manufacturer's standpoint, and they're probably focused on the big bubble on the right-hand slide here. There's always an eye on maximizing profits and meeting demand, but now you have this other backdrop of the electric vehicle tax incentives having expired for consumers, while much of the incentives for developing the electric vehicle charging infrastructure drying up. Okay. You also have a lack of enforcement now of the CAFE standards from the One Big Beautiful Bill Act. So let's cross that one out. And now you have this proposal, the proposed repeal of the GHG vehicle emission standards. So all of those things are combining to drive electric vehicle demand down, which also leads to the production and manufacture of fewer electric vehicles. So fewer electric vehicles, oops, one click too far there, sorry. So fewer electric vehicles rolling off the assembly line leads to greater proportion of fossil fuel fired vehicles in the future than what we were expecting and anticipating, which could lead to higher NOx, PM2.5, VOC, and toxic emissions. All right, so how might the manufacturers approach this? And so this is a hypothetical for a particular model of light duty vehicle, let's say on the left with the GHG vehicle emission standards in place for the model year 2027s, which they are beginning to manufacture around now. With those standards in place, the hypothetical for that model year might be, well, they would, out of every 100 vehicles they roll off the assembly line of that model, 40 out of 100 might be EVs, 30 out of the 100 might be gas electric hybrid, and 30 out of the 100 might be gasoline. On the right, without the GHG vehicle emission standards in place for that same model year 2027 vehicle rolling off the assembly line, now 0 out of 100 might be electric vehicles, or 50 out of the 100 might be hybrid gas electric, and the other 50 out of the 100 might be gasoline. So of these two hypotheticals, one results in higher non-GHG emissions. And we certainly recognize here that there's an imperfect intersection of interests and variables and factors related to demand and what the regulations require. But let's step out of the hypothetical for a minute and talk about reality. There's evidence that the markets and the manufacturers are already responding to this proposal and the complementary actions I listed on the prior slide. Reports back in October indicated that General Motors took a $1.6 billion hit related to scaling back its electric vehicle production plans. 1.2 billion of that were directly related to adjustments to their EV capacity, while the rest of the changes were related to canceling or settling EV-related contracts and commercial arrangements. Those changes highlight the burden of the loss of some of those complementary actions and the threat of this proposal. Other reports indicated that United States plants in Kansas producing the 2027 Chevy Bolt are shifting from 2 shifts per day to 1 shift per day, and other plants in Tennessee are shutting down this month in December before cutting back from 2 shifts to 1 shift per day starting in 2026. So our hypothetical is becoming reality even before EPA takes a final action on this proposal. So you can begin to see the potential consequences of eliminating the vehicle GHG standards while simultaneously removing CAFE enforcement, while simultaneously removing consumer tax credits for EV vehicle purchase, how those things together could increase emissions of criteria and toxic pollutants in the future relative to what we were expecting under the prior rules. As we noted on some of the prior slides, both the GHG vehicle emission standards and the criteria pollutant emission standards rely to some extent on fuel consumption and fuel efficiency. And with any potential increase in criteria pollutants, it would jeopardize compliance with the National Ambient Air Quality Standards, or NAAQS, in areas that are currently narrowly meeting those standards, such as the Charlotte area. There could also be an increase in toxic air emissions exposure as a result of the proposal. So in recognizing this integrated approach I mentioned earlier, where managing multi-pollutant emission vehicle emissions on EPA's part, we asked EPA in our comment letter how they would coordinate with NHTSA to ensure that there are no increases in criteria or toxic air pollutants, and how the proposal would not trigger Clean Air Act's anti-backsliding provisions, which protect our foundational control programs in our state implementation plans. As a point of reference, our division listed the 2024 GHG vehicle emission standards as a foundational control measure in our ozone maintenance plan for Charlotte. So what are the criteria pollutant impacts of the proposal? We note that while EPA says they're not changing the criteria pollutant standards in this proposal, they do acknowledge in the preamble that the possibility exists that the proposal could marginally impact emissions of criteria pollutants and air toxics. And EPA said it does not currently believe that the proposed action would have any material adverse impact on the health of individuals with respect to non-GHG pollutants, including children, because the EPA anticipates that the impacts of repealing the GHG vehicle emission standards would have only marginal and incidental impacts on the emission of non-GHG pollutants. EPA provided those statements without providing any quantification or analysis of those potential impacts on criteria pollutants to support their claim. So what are the criteria pollutant impacts of the proposal? So our staff pursued that answer through a modeling exercise using EPA's most recent on-road vehicle emissions models. Staff used the current version of the model, which is the MOVES 5 model, which includes all of the current vehicle emission standards. We also used the prior version of the model, MOVES 4, which did not have the 2024 GHG vehicle emission standards that the proposal would repeal. So while there are certainly limitations associated with estimating emissions by calculating the differences between versions of models, this provided the best methodology for our staff in the time available for commenting on this proposal. So we've primarily used the outputs from only the newer model, with the exception of the vehicle miles traveled, or VMT, from electric vehicles. So here on this slide, to estimate the impact of the elimination of the GHG vehicle emission standards, our division subtracted the newer model, MOVES 5, projected electric vehicle miles traveled in each vehicle regulatory class and year from the prior version, MOVES 4, projected electric vehicle VMT for that class and year. Without any other changes in inputs between the MOVES runs, it's reasonable to assume that the latest GHG vehicle emission standards are the major cause for the additional electric vehicle VMT in the MOVES 5 runs in future years. So then we simply just multiplied that change in electric vehicle VMT by the MOVES 5 emission factors for fossil fuel-fired vehicles, again, assuming that the future, that's model year 2027 and beyond, those miles will now be fossil fuel-fired vehicles. And we did that analysis for 2035 and 2050, and we did it only for Mecklenburg County. One, we only had time to do it for one county, but two, Mecklenburg County is the area of the state that is narrowly attaining and meeting the ozone standard and the annual PM 2.5 standard. So let's look at some results. The estimated change in annual VMT from fossil fuel vehicles in Mecklenburg County in 2035 and 2050. 2035 are the blue bars, 2050 are the orange bars. Yeah, so that's the VMT chart, yes. So again, this is just Mecklenburg County, and it shows the impact of removing those additional future electric vehicles from the fleet moving forward between now and 2035 and 2050. All right, so the next slide, when you multiply that change in VMT from the prior graph by the emission factors for the gas and diesel vehicles, you get potential NOx emissions increases as shown here by vehicle class and year. Again, 2035 are the blue bars, 2050 are the orange bars. And if you sum the blue bars, you get the totals at the bottom of the slide, 259 ton per year increase of NOx in Mecklenburg County in 2035. And if you sum the orange bars, you get a 452 ton per year NOx increase in 2050 in Mecklenburg County. I noted the preamble language earlier, it said marginal and incidental impacts. We submit this as Exhibit 1 as to the contrary. The next slide focuses on VOC emissions. Again, similar exercise, the VOC emission factors times the change in electric vehicle VMT, or change in VMT over to fossil fuel fire vehicles, and you get these types of results. Blue is the 2035, orange is the 2050, and the totals are there at the bottom of the slide. Next slide shows the same for PM 2.5, primary PM 2.5 increases. Again, annual increases, Mecklenburg County only, 2035 in blue, 2050 in orange, and the total annual totals for that county increases at the bottom of the slide.
Mike, just sorry, is the number in the parentheses the increase over what would have happened without the proposed change in regulation? Is that what the percentage is?
Yes, so the percentages in parentheses there at the bottom shows the percent increase in projected on-road mobile PM 2.5 on this slide emissions in 2035 in Mecklenburg County.
Yeah, okay, that helps.
So, and maybe the next slide will kind of pull it all together and summarize it best for you. So, and shows kind of the results of our analysis from the proposed repeal of the GHG vehicle emission standards may increase the annual on-road emissions of NOx by 11.2% in 2035, 35% in 2050, PM 2.5 by 6.6% in 2035, and 17.5% in 2050, so on and so forth for SO2 and VOC. Again, this is Mecklenburg County only. Our thought here is these are not marginal and incidental impacts, as EPA claims, without analysis in their preamble. Next, we analyzed the NOx and the VOC emissions on a daily basis, because daily emissions are really the metric of importance when it comes to our ozone maintenance plan for Charlotte. So the concept of a maintenance plan is you must demonstrate to EPA that your future emissions are less than your current emissions on a daily basis. So in other words, the emission level that got you to attainment, your current emissions, you now have to keep those emissions at or below those levels in the future. All right, so in this graphic, we're showing the daily emissions in the current Charlotte Ozone Maintenance Plan for 2035, and we illustrate how much higher they would be if this proposed repeal becomes final. So on the left is the bar for NOx. That's showing an 8.8% increase in daily summertime NOx. On the right is the VOC emissions on a daily basis, a 6.1% increase in daily NOx in Mecklenburg County. So while those increases alone won't violate the principles of the maintenance plan, we need to watch this very carefully. I think especially when analyzing new transportation projects through the transportation conformity process, where our margins are very, very thin for accommodating any new large road construction project in that area of the state. All right, beyond our emissions analysis, our division also conducted a critique of and also commented on EPA's regulatory impact analysis, or RIA, associated with the proposal. And that RIA included 7 scenarios. We appreciate EPA attempting to evaluate 7 scenarios. However, each of those scenarios we found contained significant shortcomings and technical pitfalls that skewed the results. Overall, EPA's lack of accounting of changes to air quality and public health impacts is a severe shortcoming in the RIA. There's really no analysis of how the proposal will affect ambient concentrations of local or regional pollutants throughout the U.S. But beyond those deficiencies, the RIA also lacks any assessment of environmental and social costs associated with GHG emissions. This stems from an executive order that was released earlier this year that now directs federal agencies not to quantify the monetized impacts of GHG emissions, claiming that such analyses would result in flawed decision-making due to over-reliance on balancing highly uncertain dollar figures against more concrete costs and benefits that can appropriately be quantified. Our comment here was, hey, to be sure, there's been a long-standing amount of uncertainty associated with various social costs of carbon values, and any cost-benefit analysis contains uncertainties to varying degrees depending on the underlying assumptions. But this inherent fact should not result in a complete disregard of impacts that are reasonably expected to occur. In EPA's first scenario in the RIA, they used the same tools, models, and assumptions as the prior administration did in setting the 2024 vehicle emission standards for GHGs. However, here, EPA simply took what the prior regulatory impact analysis for those 2024 standards were, where they listed the costs and changed the signs on the numbers to now show them as savings. And so the costs in the 2024 rulemaking are now shown as savings, and the savings in the 2024 rulemaking are now shown as costs. This is flawed in several ways, but the fundamental flaw in doing that is this proposed repeal only affects the GHG standards and not the criteria pollutant standards. And so the costs associated with meeting these remaining criteria pollutant standards are still being incurred by the manufacturers and thus can't be counted as savings in this proposed repeal of the GHG vehicle emission standards. Needless to say, our division commented strongly and disagreed with this oversimplified approach that EPA used in scenario 1 of the RIA for determining costs and benefits of the proposed repeal. Elsewhere in the RIA, there are additional instances similar to this one, which suggests that parts of this were pretty hastily assembled with minimal technical rigor and a lack of depth and a lack of attention to detail. Okay, so some final thoughts. EPA asserts that the proposed repeal could only have marginal impacts on public health or on the environment at local or regional levels. And EPA provides no supporting evidence to justify that claim. Meanwhile, our division produced a modeling analysis that showed increases in NOx, VOC, PM2.5, and SO2. Especially concerning for areas with narrow margins meeting the NAAQS, like the Charlotte area. Those potential increases hinder the state's ability to maintain ongoing compliance, mitigate climate impacts, and support economic stability and growth. Ultimately, we asked EPA to withdraw the proposed repeal and urged collaboration with states and stakeholders to implement effective strategies that protect public health and economic growth, and keep North Carolina and the U.S. globally competitive. Ford Motor Company, in their comment letter to EPA, said, hey, EPA, ease the standards. Stop swinging from one extreme to the other. And eliminating the standards altogether is not going to provide the industry with the long-term stability needed for historic investments in America and to compete globally. And so they warned EPA of regulatory whiplash, essentially. And so while their words were slightly different than ours, I would say some of the high-level messages or the same. So where do we go from here? Well, EPA has verbally stated that they want to finalize the action by the end of this year. I know they received over 27,000 comments, is my understanding, in the docket on the proposal. So, yeah, so we'll see where everything goes from here. That's what we know at this time. That's the end of my presentation today. I appreciate the opportunity to provide this informational item to you, but I want to send a special thank you and shout out to our team: Randy Strait, Katie Quinlan, Tammy Manning, Andy Bowman, Todd Paisley, Brad Nelson, and Anna De La Hunt. They did the analysis and pulled together the meat of our comments and did such an excellent job. It motivated me to turn our comment letter into a presentation to share more broadly for information, because I thought it's something that not a whole lot of people are aware of. What some of these co-benefits that might be lost are and could be lost are, and how important they are to the state of North Carolina. Thank you very much.
Thank you, Mike. We appreciate it. And it's a commendable approach to do the analytical work to back up what the policy implications would be, and the policy implications also affecting real world growth. We oftentimes talk about, like we did in the last presentation, wanting to get, once you've understood the toxicology, fate, and effects, you get into pollution reduction. You know, this sounds like an approach of trying to educate people on what the real world effects of undoing some pollution reduction would be, that you would lose the co-benefits of a variety of other pollutants associated with those sources. So a very important topic and a commendable approach to match up the analytical approach with the policy implications, with the growth implications and future management. So pass that along to the rest of your team as well. Good job.
Thank you so much.
With that, I'll open it up to any questions from board members in the room or online, and we'll start with John.
I would also say congratulations to you and your team. I think you did a great job, and I would hope you would share this presentation widely, because I think a lot of people would benefit from what you've done here and the example. The question I've got is, you didn't take it to the next step to say whether you predict that there will be non-compliance with any of the existing standards. You didn't include that. Why not?
Yes, great question. So in the time allotted for commenting on this, we could only get through the step of calculating and estimating the change in emissions in just one county. Yeah. Ideally, if we had much more time and resources, we could have taken that change of emissions as an input to an air quality model to estimate the change in air quality, specifically ozone and fine particulates would be of greatest concern. And then if we had more time and resources, take the output of that air quality model and input that into a human health impacts model to estimate changes in public health outcomes. Right. We simply didn't have the time and the resources to do that. It certainly can be done. But it's just something we couldn't do by the end of the comment period, and still just don't have the time or resources with the staff to do that.
I understand that completely for your comments there, but it seems like it would still be worthwhile to do to kind of carry it through if you could, to actually estimate, you know, not just the compliance or attainment with the standards, but also the impacts on public health, the environment. So is Charlotte or Mecklenburg County, is it NOx or VOC limited, or is it kind of both?
All of North Carolina is NOx limited. There may be times, minimal number of times, where Charlotte shows a little bit of a VOC sensitivity. Yeah. But for the most part, we are NOx limited through and through, and all of the science, the data, the modeling analysis shows that NOx emissions are still the key to reducing ozone in North Carolina. And for those keeping track at home, maybe don't know that the main reason for that is the abundant, naturally occurring VOC emissions that are here in our state and throughout the Southeast.
Right. Trees.
Yep, trees.
So you indicated very clearly that the majority of the NOx emissions, to carry that forward, were from the Class 8 trucks. That's the heavy duty trucks. Is that right?
That's correct. Class 8 are the heavy duty, the biggest of the heavy duties. So like that'd be the tractors for tractor trailer, the largest buses, for example. Yes.
Right. So is that a target for addressing in terms of the program that the state has? Is it the Class 8 trucks and vehicles that are the most important in terms of the NOx emissions currently? I mean, what you're showing there was to a future, that was clearly going to be the impact, seemed to be the greatest from those Class 8 vehicles. But is that currently the case? Is that is your largest source of NOx emissions that you're focusing on?
It's a very important, when you look at the statewide totals, it obviously can vary by county because counties that have multiple interstates running through them, for example, might have a little bit more of a signal for the Class 8 category than a county without interstates, a more rural county without any interstates rolling through them. So the light duty vehicles might dominate the profile. But if you zoom out and look at the statewide, absolutely, heavy duty NOx from heavy duty vehicles is very important to the state of North Carolina. Now, I'll note from a regulatory perspective, we don't have authority to generate our own emission standards or regulations for engines and those types of vehicles. That's retained at the federal level. And so the heavy duty NOx emission standards, which are still in place, are really important to our future, also important to our future NOx emissions levels in North Carolina. I will say that EPA has indicated that is also one of the rules that they are going to reanalyze or reconsider, but there's been no movement on that yet.
So my last comment is I wish I'd had you come give this presentation to my class. It was really, really good. So thank you.
Thank you. Appreciate that.
Any questions or comments from folks listening online on the panel?
Good.
All right. Again, thanks so much.
Thank you.
You grabbed everybody's attention when you put a delta in one of your slides. We were all over it. Had equations. The next presentation is going to be from Dr. Franny Nilsson, our technical liaison to the departments, who's going to give us an update on the consent order toxicity studies. And then I guess maybe a deeper dive into the aquatic tox study results after that.
Yes, sorry, let me just get these on the computer. All right, good afternoon. It's been a long day so far. I'm going to give two presentations about the consent order toxicity studies. The first one is one you've seen many times. It is just the clear update of the things that have happened or we've received. And then the second, for ease of reference online, is a separate set of slides, but will be a synopsis of all of the we've received so far. So under the consent order, there are toxicity studies that are required to be conducted. They are listed in detail in paragraph 14 of the consent order, but the consent order outlines these 5 compounds of the Camorra signature compounds that these tests will be conducted for. Paragraph 14 states very clearly that these studies have to be conducted following US EPA, OECD approved protocols, and that can be from TSCA or Office of Pesticide Pollution Prevention, and other appropriate programs determined by DEQ. And so that can include the National Toxicology Program. All of these different studies and their protocols were approved previously, and they were determined to include the appropriate pieces of these methods or just direct following OECD or EPA methods. There are 2 sets of toxicity study groups. These are the aquatic tox studies or the environmental tox studies. These are the different organisms in a river freshwater ecosystem that they are, the consent order is requiring Camorras to conduct these studies to determine the toxicity potential of their compounds on these model organisms. The second set are the rodent toxicity studies, and these are the ones that are more related to human exposure and applicable to derivation of a reference dose and a human equivalency value. There are 4 of these in total. There are the 28-day immunotox studies, which will be done in rats and mice for all 5 compounds, and then the 90-day repeated dose oral toxicity study in both mice and rats. And that's more of a classic 90-day toxicity study. Okay. As far as the aquatic toxicity studies go, Most of them have been completed, all of them have been completed to date. The change here between last meeting and this meeting is the highlighted bit. And so we have received the final sediment final report for Naphthalene byproduct 2, and that will be presented today in this next presentation. So to date, we have all of these final reports. They are all in-house, and I'm working on getting them all available online for everyone. Since the last update, it was really just that we received these earthworm sediment reports. We received these about a month after the last meeting, and we've reviewed them. I will show them to you today. As far as the rodent toxicity studies go, these are in a different state of completion. And so there are the 28-day rat and mouse studies that are underway now. These doses that are being used for these studies were going to be used to inform the doses for the longer term studies. So they're being done in a stepwise process, and that was agreed upon. To give you a better understanding of these dates, the 28-day rat studies that are underway currently, 3 of them have been completed. The in-life portion has been completed to date. And so that is Naphthalene byproduct 2, PFMOAA, and PEPA. All of those have been completed, and PMPA. All 4 of those have been completed to date. The draft report is something that is happening at the lab where they are compiling all the data and creating a report to send to Comores. That's not something that DEQ gets access to. That's just a step in the process. The final report is what DEQ gets. And so the 6-month interval between the draft report and the final report is set by Charles River, and that's just their standard practice. Whether or not they hear back from the contractor or the person that has contracted them with comments, after 6 months, they issue a final report. I am awaiting the PFMOAA report. The final report should have been issued just before Thanksgiving, and I was out of the office for the week before Thanksgiving for a conference, and then the week of Thanksgiving. And so I have not reached out to their toxicologist to see what the status of this is. But that is on my list for the rest of this week. And I'm imagining it's just because of the holidays that I haven't received it yet. The other ones are forthcoming in the early part of the year. The PFO2 HXA in life portion should have been completed, and I just haven't reached out to Sean to confirm that, but that should have been completed in mid-October. As far as the rats, the mouse 28-day studies go, all of the in-life portions for these have been completed as well, with the exception of PFO2 HXA. We're working on scheduling that with the lab, and this is the same status as the October meeting. I haven't heard anything about this, and that will also be in my email to Sean. We're waiting on the draft reports. All should have been issued to Comores at this point in November. And so the final reports will come to us in the first part of next year. But the analysis of all of that data in the draft report should be underway at Comores, and they should be in contact with Charles River. The next step really is to wait for these final reports for the 28-day studies that are underway and should be coming as soon as they're ready. And then I'll present the results of those at the meetings as appropriate, depending on how many of them we get between April and August. There could be a long presentation, but they're underway. The next step really is to discuss the doses and the scheduling of these 90-day studies with Comores and Charles River. We're going to use the doses from the 28-day studies to inform these. And so at this point, we are getting some of those final doses and final reports. And so we could start making those decisions probably as early as January to get things on schedule with the lab. But I'll follow up when I have more concrete details about that. That is the status update. I can answer any questions about this, or I can just move on to the other.
Let's pause for questions on this part. So you're saying that when you get all the 28-day test results in, which are almost all pending, that it's just like maybe a month turnaround to have gleaned from that your feedback into what the doses should be for the 90-day study and get those on the books?
I think that is the best case scenario, but yes, let's say yes.
And then once you've provided them to them, do y'all have any say in how fast they do those studies, or is get it on the books mean depending on when they can work it in?
And so initially when we started getting particularly the rodent studies in queue at the labs, it was shortly after COVID quarantine ended. And so a lot of the rodent labs had a huge backlog from pharmaceutical companies. And so the time between scheduling the experiment and happening was 6 months. From what I understand, that backlog is much less now. And so scheduling is a little more practical.
I got you.
I think it depends on the lab itself, and what the specific scientists that are working with this contract are doing.
Okay.
But I mean, it's a priority for them, as well as us. And so I am pushy with the dates, but there's only so much I can push for.
Other questions from folks in the room or for our board members that are online for Franny on the status of the studies so far that she's presented before she moves into the aquatic tox results?
This is Jamie. I think we've talked before just about letting me and others take a look at the raw data.
Yeah, I actually, since the last meeting, I have reached out to Dr. Gannon, and they removed the confidential business information label from the report. And so I have that to send to you and Elena and anyone else that wants it. I just, again, haven't done it yet this week, but I will send it to you. It is on my to-do list for this week.
Good. You good? All right. Let's move on to the second part of your update then.
Okay, so the series of slides is a summary of the 5 different aquatic tox tests for the 5 different compounds. It's a lot of data I tried to make very succinct slides. But I will preface this all with saying each of these compounds and each of these tests has its own 100+ page report with quality control information, validation of the concentrations and doses in water, validation of the method being used to determine the concentrations. There's an extensive amount of information in each of these reports, and some of that is considered normal in a final report, and some of it was things that I asked for due to the consent order. So those will be available. I'm the slowest link in getting those online. It'll happen. Okay, so I just mentioned this, but these are the 5 consent order compounds for the tox studies. These are all different compounds, and they have had different effects on these different models. And so I'll go through those. Just as a reminder, these are the 5 different aquatic toxicity studies that were done. There's an algal study, 2 daphnid studies, an acute and a chronic tox study. There's a fish acute toxicity study, that's the 7-day survival assay. And then this 10-day sediment freshwater invert toxicity study. The reason these toxicity tests were decided upon was because they are the different levels of biological organization in an aquatic food web. And so this is not a perfect North Carolina River aquatic food web, but this is a model of the levels of biological organization in an aquatic ecosystem. And so we'll start with the algae, which are the primary producers in this ecosystem. This test is fairly straightforward. It measures the inhibition of growth in each of the doses compared to the 0-dose control group. These are the doses that were used for all of the different compounds. The test is a 96-hour testing period, and this was based on the OECD method 201. The results that I'm showing you now, I'll orient you before I talk about them. This is the average yield or mean yield cells from each of these compounds in those beakers for these doses. The doses are along the bottom, and so each of the little dots on the line indicate a different dose. And on the y-axis is the number of algal cells per milliliter, and so those are huge numbers, and that's just the counts of cells. This test measured the reduction in growth or the impact to growth. And so if the lines go down, in a diagonal fashion from top left to bottom right, that's indicating reduced growth. The 5 different compounds are the same 5 colors throughout this presentation, just for simplicity's sake. And so I'll start at the top. Naphthalene byproduct 2 is the purple line, and you can see that the 0 dose control, which is the leftmost dot, has a little bit of a variation across the line, but it's really the comparison between the high dose group and the 0 dose group that was deemed to be statistically significant. And that is for growth rate, not cell count, which is why it's not a huge difference. The next line is PFMOAA, that's the navy line. And you can see the 0 dose starts out at a high cell count like naphthalene byproduct 2, and then the line pretty quickly drops off to still a very high number of cells, but a statistically significantly lower number. And so all of the red circles here indicate statistical significance from the 0 dose control in terms of number of cells per milliliter. So all of the doses except the first dose, which is 13 milligrams per liter, were considered statistically significant to impact growth of algae in this test under these conditions. The other 3 compounds are PEPA, which is the green line. It looks similar to naphthalene byproduct 2. There's some fluctuation, but there's no real change across those numbers. PMPA has a little more variation, but they were not found to be statistically significantly different from the control. The same is true of PFO2HXA. For algae, it was really PFMOAA that had an impact on growth across multiple doses. Questions? The next test I'll go through are the Daphnia tests, and these are the primary consumers and zooplankton in this ecosystem. The first test is the acute toxicity test, and so this test measures immobility compared to the control, which is the 0 dose group. The test occurs over a 48-hour testing period and is based on OECD 202. What I'm showing you here is the percent cumulative immobility at the end of the test. And so on the x-axis again are the doses, on the y-axis is percent cumulative immobility. So increasing immobility is bad. And so if the lines track up from bottom right to top left, that indicates reduced immobility. In this test for these compounds under these conditions, there was no statistical difference between any of the dose groups or any of the compounds for immobility. That's not to say that there was 0 immobility. There were some noted changes in some of the zooplankton, but they were not statistically significant. And there were very few changes for this particular test. I think there was maybe 1 animal in some of the groups that were abnormal or slowed immobility, but it wasn't statistical. The second test for Daphnia is the chronic test, and this is a test that is measuring 2 things. It measures survival of each group compared to the control, and measures the number of live offspring to each surviving parent compared to the control. This happens over a 7-day testing period and is based on OECD 211. What I'm showing you here is similar to some of the others we've looked at. The doses are along the bottom. The percent survival is on the y-axis from 84 to 100. So this is a truncated scale because the change is slight. And then the reduced survival is going from top left to bottom right. For these compounds under these conditions for this animal, there was very little mortality in this particular test. The mortality that was observed for PMPA was only at the very last day. So it was 96 hours, 7 days, 5 days, 7 days, 96 hours, I think. But it was just a 10% change, and it was only one animal. And so it was very slight and not statistically significant. And that's why I've zoomed in, so you can just see that it really is the one chemical and one dose group that was different. The second thing that this test measures is the number of offspring per surviving adult female. And so this is a similar setup in that decreasing reproduction is going from the top left to the bottom right. But we're looking at are the doses along the bottom and then the mean number of offspring per parent on the y-axis. There's definitely some fluctuations in these lines, but they were not deemed to be statistically significant. The number of live offspring compared to each surviving parent is how we're measuring reproductive fitness and impacts to reproduction. But that does not mean that there were not or could not be other impacts that don't necessarily impact the number of offspring. The quality and fitness of offspring were not evaluated. The fourth test is for the fish, and these are the secondary consumers. In theory, eating both of the other two. The fish toxicity test in this case was measuring survival just compared to the control group. It's a 7-day testing period, and it's based on OECD 211. I want to draw your attention again to the scale. It's a truncated scale on the y-axis because the changes were slight. The doses are along the bottom. This test is measuring immobility as a proxy for survival. There were some mortalities, and the larger changes in the study were movement of the fish before they died. And so another thing to note here is that the purple line is naphthalene byproduct 2. That study was conducted at lower doses than the other 4 compounds based on the range finding study that found naphthalene byproduct 2 to be overtly toxic in certain doses in the rangefinder. So the doses were made lower as to not kill all of the animals for 7 days. What happened here was interesting in that there were some changes in the other compounds. If you look at the right side, PFMOAA is the dark blue line that is just mostly along the bottom and just goes up to about 5% right at the highest dose group. And this is all at 7 days. PMPA, which is the lighter blue line, has no change. It's consistent across the bottom. What's interesting for one of these compounds, which is PEPA, is that there were no changes in survival or immobility at any of the dose groups except for 67 milligrams per liter. And there was some reduced survival and immobility there, but for the highest dose group, there was none. And so it's just an interesting piece of this puzzle because not every compound is toxic at very high doses. Some of them are toxic at medium or low doses. The light blue teal line is PFO2HXA, and the immobility and survival immobility and mortality went up just to 5% at the second dose and kind of maintained that until the high dose where it jumped to 10%. These are, I think, interesting changes and perhaps suggestive of other toxicity tests that could be done rather than solely survival, which was something that I talked to Dr. DiGiulio about after we looked at the range finding data, was to see if there were other tests that could supplement just survival. If you look at the NAFIAN byproduct 2 line, this line looks different in shape and magnitude to the others. The immobility mortality increases to 10% at what is the second dose, but is, less than 2 milligrams per liter, and then jumps up to 25% at the high dose, which is just 10. And so this was not statistically significant. It's not different enough from 0 to meet the statistical requirement of 0.05. But I think it's noteworthy, it's interesting, and it's quite different than the other compounds. The last test, and these are the results that you have not yet seen, is for the invertebrates in sediment. And so these are considered primary consumers because they eat detritus and then also decomposers. The invert toxicity test is done with earthworms. They measure survival again compared to the control. It's done over a 10-day testing period, and this actually follows the EPA method from the Office of Chemical Safety and Pollution Prevention for testing of spiked sediment, invertebrates and myofauna and spiked sediment. And so what is done before this test happens is that the compounds at the appropriate doses are put in a batch of sediment, and then they're mixed for 21 days. And then they're measured again to ensure that the compounds have integrated into the sediment before the worms are put in the sediment and the different doses are set up. The photo I have here is not exactly the way this experiment came to pass. These were done in open beakers with the sediment and then overlying water put on top. And then at the end of the study, they measured the amount of PFAS of specific compounds that they put into the sediment, what was in the sediment at the end, what was in the water, what was in the pore water, and then also measured that by mass and proportion. And so it's an interesting look at where these compounds are going in the aquatic environment, especially because some of these are small and not normally precipitating out into the sediment. But all that is to say, they also measured it in the worms. So I have 2 sets of the same results because I think the second set might be easier to look at. But the way that this is set up, it's quite the same. The doses are on the x-axis here, except 0 is here in the middle because there were some negative reductions to survival, which would be increases to survival. And so reduced survival increasing to the top left, top right, is indicative of a toxic change. Here, we can just go through the lines. I didn't label them individually with the compounds. My apologies. I'll do that before I post this. The purple line is NAFIAN byproduct 2. And if you follow that up, the top 3 doses here were statistically different from the control. And so this is reduced survival or mortality. And they measure this by number of animals, weight, wet weight and dry weight, because if worms break in half, they can regenerate. And then you have 2 individuals, but it's not truly more. The second line is, this is a dark one. PFMOAA is this dark navy line. And there were some interesting effects in the PFMOAA group. It was essentially every other dose had the toxic response of reduced mortality in a statistically significant manner. The report does say that while this is statistically significant, they don't consider it biologically significant because it's not a typical dose response. Based on the other toxicity information I've seen about PFMOAA, I don't necessarily know if it's not biologically relevant, but that it is toxic at different doses than some of the others. And so it's an interesting pattern, and I'm curious to look at it a little closer and see what some of the invertebrate experts in the area make of it. But that it's an interesting pattern. The next line is PFO2HXA, which is this teal line. And the last 2 groups here were statistically significant from the control. The last one is this medium blue line. It's PMPA, and the last 3 groups here were statistically significantly different from the control. So there was a lot of statistical significance in reduced survival for this test. What's really interesting is that PEPA didn't have reduced survival. It had increased survival, which is interesting. And that's measured by weight. And so it doesn't necessarily mean that there was more surviving. It could be a sign of over toxicity and heavier animals with increased organ weights. That particular piece of the puzzle is unknown. It's just an interesting effect. And sometimes this happens in toxicity studies where you have almost the opposite of what the test is designed to show happen. This is the same data, and I think it's a little easier to look at this way. And so instead of what I have here, the reduced survival, these are the survival factors that the lab came up with to show the magnitude of change. And so these are arbitrary unitless numbers that they assigned based on each compound. And here the reduced survival is going down. So the survival factors getting lower is showing less survival. The same points along the way are statistically significant. I think it's just a little more clear to see the reduction in survival with this information plotted than the previous graph, since it doesn't go past 0. But again, the green line is not statistically significant at all. Okay, so that's a lot of information. It's a lot of high-level summary of very detailed reports. And so I figured I would give you another very high-level summary. This is a table that shows all 5 of the aquatic toxicity models across the top of this table with the Camorra's compounds down the side. And what I'm showing you here by the presence of these colored blocks is that these are the PFAS that yielded a toxic response in at least 1 dose in a statistically significant fashion as described in the final reports. They're different tests, so I could have explained all the different tests. But, they were different for each particular final report. The only one I want to bring your attention to that it was not statistically significant, but I did put on this table, is for the fish, for Naphthalene byproduct 2. It's not statistically significant, but I thought that it was noteworthy since it was so different than the other compounds. And we have a lot of information about Naphthalene byproduct 2 and its toxicity, and so I think that there could be more to investigate with our academic research partners in that avenue. So I wanted to highlight that here. But this is just an overview of the synopsis of the results. And it is, I think, interesting that the sediment, earthworms and sediment had so much statistical significance from the control. But if you think about the way those animals make their living in the environment, it makes a lot of sense. They're soft-bodied animals living in spiked sediment, eating spiked sediment. And so they're getting a lot of exposure over 10 days to all of these compounds. And it's a very different mechanism than the other aquatic models. So I think it's interesting, and I'm still looking through all of the details of the sediment reports. There's a lot of measurements made on the way that the PFAS are partitioning. And so it's an interesting study in the way that these smaller PFAS move in a mesocosm aquatic environment. Okay, so what do these results actually mean? And these results, there are aquatic toxicity results, ecological toxicity results. These inform the environmental impacts of these compounds in the Cape Fear River and other aquatic environments in North Carolina. All 5 of these required toxicity tests will provide the basis for the understanding of how these PFAS have impacted different trophic levels in freshwater ecosystems. With the exception of Naphthalene byproduct 2, the other 4 of these compounds have little to no toxicity information in the literature. PFMOAA is one that has been getting a lot of publications in the last couple of years. And I like to think it's because I'm so pushy about it, but I think it is a really interesting one, and it does behave different toxicologically than some of the others. The initial intention and part of the desire to have all of these different levels of biological organization represented in these tests was to calculate bioconcentration factors for these compounds. And so these are analogous to the bioaccumulation factors that we calculated from the fish data that we collected from the river. Bioconcentration factors are often used in place of accumulation factors because they can be derived based on lab studies. They're considered a little less protective since it's just the water exposure, whereas the real world data is showing you all of the true routes of exposure and accumulation. But these are compounds that were not necessarily measured in any of our fish. And so this is a real source of information to create these bioconcentration factors for these compounds that are needed for surface water laws, not just in North Carolina, but in many states. As far as the relation to human health, these results are unlikely to be used to derive human health values, particularly without rodent data to corroborate the findings. When rodent data is available, these results can be used to better understand some of the things that are happening with rodent data. There have been studies using zebrafish for developmental investigations when reproductive mouse models are showing that there's an impact to the offspring. The zebrafish model is able to kind of extend that developmental period and probe different questions to development in a more accessible fashion than an in utero mouse. But so that's the relevance and what these results mean to me. Just to review, upcoming and ongoing rodent toxicity studies, there are many. The next steps are to receive and review the final reports for the 28-day immunotox studies. And then we have the 90-day studies on the menu that we need to get the doses set up for and get on the schedule at the lab. But those are the two next steps. And that's the summary that I have for you today. I can take any questions and try to answer them.
Yeah, great. Thanks so much. I'll open it to questions from any of the panelists in the room or online. Can you back it up to your summary slide that had the compounds for which you saw as statistically significant? Yeah, that one. Any questions from anybody or comments? John first.
I really appreciate all the data. So two questions really. One is there a plan to publish this in the literature someplace so that others can see this besides just us? What is that sort of downstream plan? Is there one?
So I would love if the Charles River scientists or Dr. Gannon wrote this and published it in a scientific journal. I don't think that's something that I can do since it's technically not my work. We are going to put this on our website for review, but that doesn't preclude it from being published.
It would just be an encouragement to do so, I think, because that would be good to get it out in the literature for others to benefit from it. So.
Oh, I agree. Absolutely. Yeah. And for, a lot of these compounds, these are the first studies being done with them. Right. And so I think they are hugely important and should be published. And so all I can do is encourage them, I guess.
Okay. The second question is, you had kind of point values for all the data sets, and you've got a lot of data there. I'm assuming that there were replicates or you did statistical tests, so there must be some data about the response to each of the concentrations of exposure and the number of responses, I guess. Is that right? Because you're just using a point source just to show it for us. Is that right?
Yes, yeah. And so for all of this, it's the mean value, is the mean of the dose group for that outcome. And it was just a way to summarize it and show it all quickly. But in the final reports, they are all broken out, and there are many figures and tables.
Okay, thank you.
Yeah.
Thanks very much.
Yeah, and when I get this website up and running, I'll send it out to the board just for your awareness.
Great, thank you.
So just following up a couple things on the publication, there would be the opportunity for the results that you thought were the most meaningful for even like a short communication, because then the short communication could link back to your website or all of the stuff that somebody could go to if they wanted to see the full data set, because it's too big of a data set for a publication unless that was somebody's primary job at the lab or here. It would be a ton of work. But a short communication that said, hey, one of our significant findings was X, and here's all of the data on X, but you can see all the rest of the work here, would be a way to get it in the literature so that people would even find your website where it would all be, and maybe a quick way to do it.
It's a great idea. I've never written a short communication.
They're fun.
Sounds
I mean,
easier.
you're in and out, in and out. Another thing on these for the, the slides that you shared are helpful in seeing all of the compounds on one slide per assay. And it gets you to this point where you say, well, here are my meaningful results. It might help, following up on John's point, for PFMOAA and these other ones to now go to only one compound on a slide with the error bars, and someplace on there put down an expected environmental concentration, since these are milligrams per liter. And you're not saying anything about risk. You would just be saying, here's the median value that's been detected in North Carolina, or here's the 90th, or here's the maximum value that exists in our exposure data set. And then somebody could look at that and say, oh, are these effects occurring at concentrations that are less than we see, about what we see, or an order of magnitude higher than what we see? Again, I wouldn't have done it for this presentation because you're showing us what the lab found.
Yeah.
But as you take it one step further and try to tell people what the implications are, a compound by compound slide would let somebody see the variability around the data points that John mentioned, and also just one or two hash marks that says, this is what's here. Ideally, you'd have some toxicological threshold or something like that to compare it to, but probably don't. But you could at least compare it to ambient.
That's a really good suggestion.
Any comments, questions before we open it up to panelists online?
Just a quick one. Were the internal doses measured in each organism, in each of these organisms? And you mentioned bioconcentration factors. So is for each experiment water and internal organism data available?
I want to say yes, but I just don't recall the actual table in the report. I know with the worms they did, because they were, and those are the ones I've reviewed most recently. They were determining the percentage of the partitioning into these different compartments. And so my instinct is to say yes, but I will confirm, because you're right, we do need that.
On that slide that was confusing about percent survival, or survival increased from 100%, I've seen people report that as biomass instead of survival, because it's the combination of what's living and how heavy they are. And so if it was called biomass, it's still fair to call that endpoint, and biomass can be decreased by survival going down, or the animals are sick and they're not eating, or the animals are doing really well and biomass could go up. And so then it would be, it wouldn't be the head scratcher of how could you have made more organisms, except for maybe the splitting thing. But that combination of survival and growth is oftentimes just called biomass.
That makes a lot of sense. And the way that they measured the weights.
Yeah, it just saved you having to explain a step, because it's the same concept of survival times weight, and that both are important. Anything from panelists online in terms for questions for Franny on the three things that she covered: the status of the consent order studies, a deeper dive on the aquatics study results, and the plan going forward for the mammalian studies?
Hey, this is Jamie. I just have a comment.
Yeah, Jamie, the floor is yours.
So Franny, I appreciate that in this presentation, you talked about biological differences versus statistical differences. And I think we talked about that at the presentation in October as well. I think it's important that when these data are conveyed to the public, that maybe we have something that helps them to understand the difference between biologically significant effects and statistically significant effects. When I teach statistics to toxicology students, I always tell them, your data make the decision. You make the decision, not the statistics. The statistics aid you in supporting the decision that you've made, but the decision really should be on the biological relevance of the findings with support from statistical significance. So in other words, statistical significance does not dictate whether or not something is biologically meaningful. So I think it's important that that gets conveyed to those who just may be looking at these slides.
Yeah, I agree. That's a great point. And that's actually one of the salient things I learned when I was at MUSC was that not all medical studies or medical decisions or innovations are made by statistical significance. A lot of them are biological significance that are not statistically significant, and pharmaceuticals are the same way. And so it is a good point, and it is one that I often forget when I'm just reviewing data like this, but it is a good point that biological significance doesn't always equate to statistical relevance or significance.
Exactly. We could probably have another hour or more conversation on the appropriate significance level for the p-value and whether or not 5% is really appropriate or not. So
we're running ahead of schedule if
Yeah.
you want to.
We have 16 minutes left.
Other comments or questions for Franny?
This is Elena. This is in regard to another way to get this data out there, and that is presenting these findings at local or national meetings with, again, a link back to the original data on the website. And thank you for a very nice presentation.
Thanks. Yeah, that's a good idea too. And I hadn't really considered presenting any of this at any toxicology meetings. But now that we have the full aquatic data set, perhaps that is a good idea.
Yeah, you can include the Charles River folks as co-authors if they want to. If not, just acknowledge them as the source of the experiments, but the interpretation would be and presentation would be yours.
Okay. Yeah.
Yeah. And this is Elena again, just to add, I've done that exact thing that Tom just suggested with some studies that we had done under contract.
Great. Awesome. Thank you.
Any other questions, comments, perspectives from the panelists before we move on to the next agenda item? All right. Thank you, Franny, for the newsy presentation. We appreciate the update. That moves us on to the second to the last item, which is public forum. We didn't have anybody signed up to comment early on, do we, at this point? And nothing online, Julie? Anybody sign in to comment?
Not for.
Okay. All right, then before we adjourn, I'll just share a couple of summary observations. I first wanted to express my appreciation to all the board members, the ones that came in person and between in person and online. We had 9/10 of the board participating, including one who joined us from vacation and another one battling through illness. So thanks very much for your participation. I appreciate it. And I'm also appreciative of the work that was done in between meetings and the preparation for this meeting to have a productive discussion today. I was also proud of the way that the board members handled the discussion for 1,4-dioxane. It's a science advisory board, and science is the pursuit of knowledge based on evidence. And almost by definition, it calls for scientists to be skeptical. It encourages skepticism. It asks us to follow a process of questioning, sometimes when the evidence is quite limited. And so the reason that we do peer review is to foster that questioning. And I thought the way that we handled 1,4-dioxane was both informative in bringing out a line of questioning and around robin, and it was also fairly robust and respectful, so I appreciate that. And then I wanted to thank Franny for her work on the agenda, Julie for the IT support today. Excellent job. Thank you. And Paula for the logistics of lunch and parking and other aspects of the room. With that, I will pause before I mention when the next meeting will be and see if there's any other comments or questions from board members before we move to adjourn.
Not from me.
Our next scheduled meeting would be for April 1st. There's always the opportunity to, and I'll work with Franny to get a list of the dates out for people to plan on. They'd still be Wednesdays. They'd still be 10 o'clock. They'd still be probably every, on the cycle that we've been on, but people can put them on their calendars. I'll remind folks though that there's always the ability to have a between meeting, in person or virtual meeting if needed. And there's a proactive role for board members. So if you have a topic that's been on your mind, you can use some of this between meeting time to suggest something, and maybe we could have that show up on the agenda. So that would be the next meeting. It would be appropriate for a motion to adjourn, given that we've completed our agenda.
So moved.
Is there a second?
Second.
All in favor, say aye.
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 All right. Thanks, everybody. Thanks again for those joining remotely. We appreciate your participation all day long. Have a good one.